Hello, doctors. I know that we have completed already two important microbiology revision, rapid revision classes. One is completed bacteriology and two was mycology, parasitology, and virology. I'm sure you guys are thorough with that, and definitely I know that you're going to do great in microbiology. And now one final revision, just the image based, okay? Because we have discussed all the images also previously. Now one re-revision that you shouldn't miss this thing because images are same images, they're repeating every time. So you should be thorough with that. Just by seeing the picture, you should get in your mind. So I've made it so easy for you. So let's start it and finish it off quickly. Okay. Yeah. Now look at this image. First image. Yes. Look at this image. I think you guys are guessing. You're right. You already got it. So the first image. What is the first image? It is, look at this. It looks like a barrel shape. This looks like a barrel. A barrel, or you call it as what? You call it as a dumbbell. Barrel or dumbbell. You remember there's a dumbbell in the pox virus. We're going there. We'll come in a while. Now remember there's a barrel or dumbbell-shaped egg. Okay, dumbbell-shaped egg. So now what is it? And look at this picture. This picture you see a coconut cake. It's a coconut cake rectum. Coconut cake rectum. It's like a rectal prolapse, and then it looks like a coconut shell. You see coconut cake. So what is this? How to remember this? So I would tell you simply, try to whip or break the coconut. You have to break the coconut with what? Your dumbbell, your barrel. Okay, dumbbell or barrel. This is the shortcut I'm going to give you. It's easy. Okay, why I said try? Because this egg and this all belongs to which one? Which parasite? Trichoris trichuria. Trichoris trichuria. Why I said trichuria? Why did I give try? Because you have Trichinella spiralis. So don't confuse with that. This is try. Both try it should come. Okay, try. So try. Whip, because this is also called as what? Whipworm. This is also called as whipworm. Trichoris trichuria, otherwise called whipworm. Question. Okay, so this question can come. Parallel dumbbell is trichoris trichuria in stool examination, wet mount of the stool, and or coconut shaped rectum can come because rectal prolapse you can have it. So simple. So one question you're going to make. So this is the first picture. Okay. So easily you can score if you get this picture, right? No any mistakes. If you see plug on both the sides. Some people used to remember like this. In the side you put a TT. TT. So trichoris trichuria. That also easy way you can remember. Or this whatever clue I'm giving. Otherwise it's whipworm. Okay. Whip is better because other name if they give, then you shouldn't get mixed. Okay, try to whip or break the coconut with dumbbell or barrel. Very simple, right? Now next one, the second image. Look at this. There are this egg, this embryo. You can see the embryo. One has a space. In one there is a space, and another one, this crescentric space I'm talking. This crescentric space you're seeing. In this you see no space at all. No space. So you know that this type of egg, if you have a space, then that is what? That is fertilized. That is fertilized egg of which one? We want to talk. No space means non-fertilized egg. Non-fertilized egg of what? Ascaris lumbricoides. Expected question. Ascaris egg. Your Ascaris lumbricoides egg. Okay. Ascaris egg. If there's a space, then it is fertilized. No space, not fertilized. And remember that fertilized eggs will float also. That is also easy to remember. Fertilized egg will float, but non-fertilized will not float. Okay. F. Fertilized float with space. Ascaris egg. You can have a question there. Okay, got it? Right. Next. Now the third image. Look at the third image. So what is this image? This one, whenever you see the segmented blastoma, segmented embryo, we call it as, when you see the segmented embryo, segmented embryo, or when you see what blastomere, you call it blastomeres. When you see a blastomeres inside the egg, you know what it is. Whenever you are segmented body, you like to what? Hook up, right? Hook up. When someone is having a segmented body, you want to hook up. So hookworm. And hookworm, that's a Chandler index more than 200. That is PSM kappa. I'm not going to bring it here to say it is endemic or whatever. Now hookworm. So hookworm is what? That they are ancylostoma, and other one is Necator americanus. Ancylostoma and Necator americanus. Okay, these two are the hookworms. You know that one. Okay, iron deficiency anemia, most common cause. I'm not going to touch that. We are talking only the image. What about this one? This is called cutaneous larva migrans. cutaneous larva migrans. Cutaneous larva migrans. So cutaneous larva migrans can be caused by different things, but you see this larva is migrating inside like this here and there. Okay, so usually it's caused by same these two only. Answer to my with that you can add yes. SAN. Remember my name San. Santosh San. San, what happened? I migrate into the skin like this. I'm just, I like to migrate. Okay. So S for strongylitis, S for strongylitis, A and N is Ancylostoma necator. Same. Okay. S for strongylitis. I'm going to write a strong. Yes, you're right. Strongy, I'm going to write so that you will remember easily. Okay. Strongylitis, then A is for Ancylostoma and for necator. So when the migraine is going like this. Okay. That's it. This is the third egg. Fourth egg. Look at this fourth egg. In fourth egg, what I'm going to see. So this one, look at this. Here the egg, this egg is open. There's a lid and it looks open. So this is called what? Operculated egg. Operculated egg. Operculated egg. Okay, this is called operculated egg. One second, sorry. Operculated egg. Operculated egg. Now in operculated, yes. Okay. Now in the operculated egg, how to remember this operculated egg? Whenever you have a sex without condom, open sex. When you have an open sex, what happens when you have open sex without condom? You end in STD, sexually transmitted disease. Okay, so this is operculated egg example. S for Spirametra, which is not that important organism. T for all the trematodes, okay, except trematode means all. Clonorhynchus will come, your Clonorhynchus, your Paragonimus westermani, Opistrochus, all those things, except who? Schistosomiasis. Schistosomiasis, because I already told you, sisters, the church sisters, they cover themselves, right? They're not open. So they are clean. So they covered themselves, covered completely, closed. They are very closed, reserved. Okay. D for Diphyllobothrium latum. D latum. Okay. Diphyllobothrium latum. So Diphyllobothrium latum, because these are the open eggs. Okay. Diphyllobothrium latum. Okay. Fine. This is the shortcut. You know that you should remember. Okay. Right. Now look at this egg. Now we talked about schistosomiasis. So schistosoma, when you talk about schistosoma, so this is a fifth egg. We are talking about a closed egg, right? This is schistosomiasis, schistosomiasis egg. Schistosoma is causing eggs. So look at this. There the egg is completely closed, number one. But here the tricky part is you have a spine. S for spine. You will have a spine. You have a spine. Okay, remember that. That is one. And as of course, you should know there's only single intermediate host, that is snail. Okay, that is specific for the schistosomiasis. Now, when you see this spine, and if it is sideways, you call it schistosoma mansoni. How to remember? Mansi has a side ball. Mansi ka ball has side mein hai. Okay, remember like that. You remember Mansi has, she's a beautiful, remember, I'm going to make it a beautiful her. Let's draw a picture like this. It will be more beautiful and attractive. Okay. Okay, let's say this is a Mansi. This is a beautiful Mansi, this girl. Okay, look at her. She has this ball at the sideways. Remember like that. Spine in the sideways is a Mansi. So what about this one? What about the other one? The one which is the terminal end. Okay, the one which is in the terminal, you see here the spine in the terminal. So T, something terminal. So this is schistosoma hematobium. T is there. Hematobium. Terminal for T for terminal, T for T. So this is system hematobium. And look at this. Here you see a small knob, small nose, small knob. Who has a small nose? Small nose or knob, we call small nose or knob. Chinese people. I'm sorry, Japanese people. See, not Chinese, Japanese people. So this is Schistosoma japonicum. And I'm not going to discuss disease. Discuss Katayama fever, even Mansonian Katayama fever, bilharziasis. Okay, that we have already discussed in previous year. Only egg. Hematobium cause urinary infection, urinary bladder infection, bladder carcinoma, also schistosoma hematobium. Okay, so that and all I'm not going to talk, but in case if it comes also, okay, UB cancer. Okay, urinary bladder cancer. Okay, bus. Next one. Sixth one. What is this picture? This picture, by knowing only you should say this is cyst, right? This is cyst. So which cyst is this? By seeing only you can tell me which cyst is this. This is hydatid cyst. So hydatid cyst. You know that in hydatid cyst the definite host is dog. Okay, definite host is dog. Dog is a definite host. That is one thing. Now that is Echinococcus granulosus. Another name is Echinococcus granulosus, hydatsis. And in the CT scan, if you see this section like this comes, these are all our cysts. Okay, the same cyst they put in CT scan. So this is a hydatid cyst that is caused by Echinococcus. Echinococcus granulosus. Dog is a definite host. That's it. Okay, I'm running because we are not going to discuss the whole story. We have discussed already. Now it's just a picture. So look at this picture. This is a plano-convex. This is a convex egg. This is a planar convex egg. Okay, planar convex eggs, how to remember, sir? It's difficult. So look at this. On one way, it looks like a D, it looks like a D shape. If you ulta, then it's D shape. So what happened? When the child at night time, when he has perianal itching, we all had in a child, perianal itching. Okay, anal itching was there. When we had a perianal itching, what we don't call always mom. Okay, we don't, moms will busy. So we always call as sisters. What we call them Didi, right? We call them Didi. We could take help from DD. So what is that? Whenever I'm talking about perianal itching and DD means which one is that? You already know it is the enterobius vermicularis. Entero expected question. This time you can expect this enterobius vermicularis. Enterobius vermicularis is the answer. This is otherwise called, lot of names. You have to call it a pinworm, threadworm, seatworm, pin, thread, seat. Everything is same. Seat because it's buttock. You're sitting on your buttocks, right? Pin, thread, we can see from our eyes, or we can see with our own eyes. Okay, so these things. So, one more important thing is that for this enterobius vermicularis is fine. So, what is the special thing? How do you diagnose? You do a tape called NIH tape. NIH tape is a special tape, only Scotch tape. You stick on the perianal region and you take it. Okay, because the pinworm will be present in in the perianal region only. Okay, so you can place the egg in that perianal skin. So you have to with the NIH, National Institute of Health tape, and then you take it, and you remove it and do it. Okay, this is the special things you're going to do. Okay, NIH swab, we call NIH swab or Scotch tape. These are the things, the special tubes. Okay, so anything with this thing comes, you will easily answer now. Enterobius vermicularis. Look at this egg. Look at this egg. This one was, one second. Sixth egg, and this is seventh egg. Yeah, this is number 7. Yeah, this is number 7. Now, number 8. Number 8, look at this beautiful egg. This egg, if you see, if you have this egg, 6 hooklets, that is 3 pairs or 6 hooklets. 3 pairs, or you can simply say 6. You should have a 6 hooklet, plus there is this polar thickening. This is a polar, this polar thickening, this is a polar thickening, and yolk granules. Egg yolk granules. If these things are available, this organism is what? Already, that is either it could be your Tinea, Solium Tinea saginata, and other one is your H. nana, Hymenolipis nana. Okay, these are the common tapeworm, cestodes. Okay, H. Tinea, H. nana, it could be. But you have to remember, this yolk granules and 6 hooklet is absent in Hymenolipis diminuta. It is absent. It is not there in diminuta. They will not ask, don't worry. But if it is absent in diminuta, usually you will get Tinea or H. nana. It can be Tinea solium or Tinea saginata or H. nana, doesn't matter. So this typical egg, okay, egg with 3 pairs of hooklets, or you call 6 hooklet, 1 polar ending, and the egg yolk granules. Easy. Okay, in stool examination, this thing can get easily your answer. Okay, fine. This is one. Now, what about this picture? This picture repeatedly asked, very well. This, by seeing this picture, you must be happy. So, what is this picture? This is a CT scan, brine. So, if it's brine, you see this star. You see what? Starry sky appears. Starry sky. Or simply you can say stars in the sky, or starry sky, stars in the sky. You see full stars, brightening stars in the sky. So this is which one? Your neurocysticercosis. Neurocysticercosis, which is caused by Tinea solium. You know this one. I don't want to repeat all the things. Okay, one question. In biopsy, of course, you'll see what Swiss cheese appearance you see in the biopsy of this thing. But when you do a CT scan, you will see what this starry sky appearance, this picture comes, that is neurocyst. The most common CNS parasite is Tinea solium, and most common seizure in India also solium, most common in CNS parasite in children also neurocysticercosis. Okay, you know the Tinea solium. Okay, this other picture, one thing. Okay, right. Now next one. Look at this also. If you look at this, this is spot on. You will be knowing this one. So look at this. It looks like exactly like a flask. So you have a flask-shaped ulcer. I know you're already guessing flask-shaped ulcer. Number 1, either you have this picture or you can have a cyst. This cyst is containing what? Cyst has 4 nucleus, round, and it is round. Cyst is round with 4 nucleus. That is quadrinucleate. Quadrinucleate. Okay, quadrinucleate cyst. This is a trophozoite. This is a trophozoite. You see this trophozoite. It has what? RBCs inside. It has RBC, erythrophagocytosis. We call it as erythrophagocytosis. Erythrophagocytosis. I'm not going to go deep there. Erythrophagocytosis. So this picture comes. What is the answer? What is the thing you're thinking? This is the amebiosis. Amoebiasis. That is usually what? Entamoeba histolytica. Entamoeba histolytica. If you get this picture, you'll be very, very happy and should be lucky. Look at this sauce. What sauce is this? This is the anchovy sauce. Anchovy sauce. Anchovy sauce, when it is causing a liver abscess, when your entamoeba is causing liver abscess, you will get this. So if this picture comes, and which one? Again, it is entamoeba histolytica, which causing the amoebic dysentery. Very, very simple. Everything related with what? Your amebiosis, entamoeba histolytica. Finished. Okay. This is the infective form. This is the diagnostic form. Professor diagnostic consists is the infective form. Okay, you know that one. Now, next one. This is very, very nice. Two important questions here. Definitely you can expect here. First one, look at this. Look at this picture. This trophozoite, it has single nucleus, only one nucleus. You see, only one nucleus, no? So it's a single. So single nucleus, and there is only trophozoite, no cyst, only trophozoite. Means again single. Everything is single. Okay, this picture, right? And then of course you have 3 pairs of anterior, like anterior means there is 3 pair and one single flagella is behind. Okay, the hair is like this, beautiful hair like this. Okay, 3 pairs. Okay, and then what you see here? You see a strawberry vagina. So you know the clue already. Single nucleus, only single nucleus is present. And it has only trophozoite. It has only trophozoite form. There is no cyst. And this type of picture. And then they will give you what? This vaginal discharge also positive. Vaginal discharge is positive. And how will be the vaginal discharge look? Greenish discharge. When they give greenish discharge. If they give, what is your answer should be? This is, who is this girl? This is Trisha. I told you Trisha. Trisha means, I told you, Trichomonas vaginalis. Why did I say Trisha again? First of all, Trisha is single. She is single. First of all, she is single. And she has only trophozoite. That means no cyst. She is single. She just trophozoite, no boyfriend, no cyst. Okay, single nucleus. And rest, other one, you see, she loves strawberry. That's what I told, what? Strawberry vagina. Okay, and then I told she loves green veggies, green color discharge. Every word and term is important. Trichomonas vaginalis is 100 times repeated question. Expect this question. This picture will come in vaginal discharge. This picture comes, and then you have to write it. And then not only that, you know that she has this beautiful eyes for twitching. So which motility we are talking here? We're talking about the twitching motility. Twitching. Trisha twitches her eye. Twitching motility. Okay, twitching motility. And other thing is what the media. Media I'm not going to discuss so much because you know that she has beautiful eyelash. So that is lash cystine media. And other one is your, she has this diamond necklace. So she is a diamond media. So cystine lash diamond media. This is more than enough to know for Trichomonas vaginalis. Of course, the partner also should be treated with metronidazole. Okay, not going much there. So Trichomonas vagina expected question. So I know by this time, you know, strawberry vagina, you know. Okay, there are many strawberries will in upcoming topics we will study. But now remember, for a while, now you remember this only. Of course, you know, strawberry nose, rhinosporidiosis, strawberry tongue is where it's just scarlet fever. You have strawberry tongue, and strawberry lips in Kawasaki disease. Okay, so many strawberries. So right now you will go in order one by one. So look at this one. Now look at this guy. He's having a tennis racket. Before that, look at this. This is a cyst. This also, it's like a this is a trophozoite, but you see there are two nucleus, and then there are how many? There are 8 flagellas. Okay, if you actually count properly, this picture is not here good. You will have almost 4 pairs. That's 8 flagella and 2 nucleus. Okay, this is one thing. So it looks exactly like what? Tennis racket. Okay, so tennis racket appearance. Tennis racket appearance. We have one tennis racket there also. Remember, Clostridium tertium also has tennis racket. Now remember here, the tennis racket appearance trophozoite and an oval shaped cyst. Oval shaped. Here the 2 nucleus. It can be 2. It can be 1, 2, and 4 quadrinucleate. So oval cyst. Oval shaped cyst with an axostyle, center axostyle. Okay, cyst. So this one, if it comes, then this is a tennis racket trophozoite. This is one clue. So now what is this? This picture comes, you already know. So look at this guy. This guy is hitting the Gia. Nobody likes Gia. Gia is, nobody hates, everybody hates Gia. Is beating with tennis. That means what? Gia already have a clue. Giardia. Okay. So Giardia lamblia. Giardia lamblia is the answer. If you get this picture, you're very, very lucky. And you know it causes steatorrhea. Steatorrhea is fat malabsorption, fatty diarrhea, steatorrhea. Steatorrhea is the clinical picture. Okay. So overseas to and one more thing, you know that what is the motility? He is hitting the Gia. No? So Gia will fall down. So falling down motility, falling leaf motility, falling leaf. Okay, falling Trisha trichomonas vagina, she twitches her eyes. But your Gia, what you do, you, the tennis racket hits, so it falls down. So falling leaf motility. Very, very simple. No mistakes, no mistakes allowed here. Okay. I'm sure you're not going to make any mistake. I'm sure, damn sure. Okay. Now look at this picture. Now these are the latest pictures they're going to ask. Well, recent exam in your INI-CET, they have asked this question. That means you can expect in your exam also. Look at this. This is a cyst and this is a trophozoite. Here is something very interesting here. What is interesting, sir? Yes, I'm going to tell you now. Look at this. Here, you see the hair, and hair. So imagine, trophozoite is having a, this is the only flagella. This is the only flagella that is having a hair. This is the only only parasite that is having a hair. Okay, look at this. Who else has hair in the forest? Who this is? Our Balu, Balu bear, he dances. So this is what? Belantidium coli. If they given the word cilia or hairy trophozoite, Belantidium coli. It is similar to, it will be similar to amoebiosis, exactly like amoebic dysentery. But only difference will be the egg. If you see like this trophozoite, but I shouldn't say egg, I should say the trophozoite. So trophozoite is a hairy, this one. And another thing, what is the motility? Why they are dancing? Whatever motility is, this is a rotating motility. This question was asked again recently. Rotating motility. Balu rotates. See, Bala, the bear rotates, rotating motility, Belantidium coli, and here another important thing is that everything is the biggest. This is the biggest parasite. This is a big B for B, B for B, B for big. Okay, biggest parasite. Number two, you see both the system trophozoite. There's two nucleus by Balantidium by B for B, by nucleus. So big nucleus, this is the big nucleus, and this is small nucleus, big and small, big and small. But the big nucleus, how does it look? Kidney shape. It looks like a kidney shape. Okay, kidney shape. This can be asked. Kidney shaped nucleus is seen where Bala as kidney is like a this thing. So everything with Bala, you will not forget. Binucleate, big nucleus, everything big. Go to Balantidium. Okay. Now another two interesting protozoa. We are still in a protozoa, and all our protozoas we are talking here. This you can't make mistake. You have to know, no other option. Okay. What is this? So what you're seeing in this picture is basically, this is Pamela Anderson. Pammy. We call her Pammy. Pammy with a boyfriend, what? With a boyfriend named Nigel. Nigel. Okay, Pammy with Nigel. You have to know this clue. There is no other. I'm not going to give any saying to no need here. You have to know why. Because first of all, Pammy is what? Primary. It's a primary amoebic encephalitis. Look at them, they are in the swimming pool. And Nigel is what? Naegleria fowleria. So Naegleria fowleria in a swimming pool, they get what? Primary amoebic encephalitis. This is the one. Exactly. The trophozoite would be looking like this. See, beautiful design. So Pammy will look like this, very design, anything like very beautiful design. On one hand, you can see this spine-like thing. And this, then that is your primary amoebic meningoencephalitis caused by Naegleria fowleria. Question will come. Definitely, this picture can come. Naegleria fowleria. So that is okay. Then you will have a clue. It's a free-living amoeba. These are free-living amoeba. Easily you will find it out. Now look at this. This is our this is a which guy? Acorn, right? Acorn, you everyone knows a popular singer, very popular. Acorn means the word itself gives you clue. Acorn. Before that, acorn, first of all, you see he's having spike. He likes to have spikes. Acorn likes to have a spikes. So if you see a trophozoite like this spike, multiple spike, he likes to have a spike. Okay. Second one, he's becoming old. So you see double chin. So when you see a double layered cyst, cyst is double layered, double layered, okay, double layered cyst. And also he wears what? Contact lens, that is contact lens keratitis. This is a contact lens keratitis. And usually when someone has this type of style, you call them what? Gae. So acorn is a gae, G-A-E, not G-A-Y, G-A-E. No offense, it's just for your remembrance. So gae is basically what? Granulomatous amoebic encephalitis. Granulomatous amoebic encephalitis, because even the most talented student will make mistake in this question, because primary amoebic meningoencephalitis, this was totally different. There is no meningitis in acanthamoeba. So the disease of this is called acanthamoeba. Acon, because acanthamoeba. This fully, these both are free living. Naegleria foliaria, acanthamoeba, free living amoebas. Okay, they usually in water here everywhere. But icon could remove contact lens where it gets it, and also you get what? Granulomatous amoebic encephalitis you get, and then double cyst and your spikes. That's it. Very, very simple. So this picture with spikes comes, you have to remember this gay acorn. Granulomatous amoebic encephalitis causing acanthamoeba. Okay, and double wall cyst it gives also easy. You have to mark it out. Double wall, because he has double chin. You know, he's big, he's thick. He's a thick guy. Become old. Okay. Now look at this. Here, though, there is no way you're not going to have this. You will have this question here. You know this one very, very well. I don't repeat it. First of all, even you see anything like this pink, this is acid first parasites. Because you've done what? Acid first staining. Remember acid first in carbamazepine, and of course this is a modified. You did a for here. You have to do a modified acid first staining. There's no intermittent heating. Modified means you do quinone staining. Yeah, quinone staining or cold staining method you do. Okay, that doesn't matter. So there are three organism parasites in stool. And one more thing, in all HIV positive patient, you see these parasites. Okay, in HIV patient, this is the most common cause of diarrhea. All these three cause most common cause of diarrhea. HIV patient, malignancy patient, it's very, very common. What is this one? First one is cryptosporidium. Sporidium. We'll go one by one. Cryptosporidium, definitely can ask. Second one, a little bit bigger than that would be your cyclospora. Cyclospora, or even more bigger than that, but little bit oval shape, that is the isospora. But please remember, nowadays isospora is called cystoisospora. So don't get confused. I never read this thing. Same thing, it's called cystoisospora. Okay, doctors, please remember that. This is causing a lot of confusion. Students are making very the mistakes which they not supposed to make. Okay, right. Now let's go one by one. First, size is important. You have to know size for these organisms. Let's start. It is 4 to 6 micrometer. Then double it, that would be icyclospora. It's 8 to 12. And again, this you double it, it's going to be 24 to 36, 24 to 36 micrometer. Okay, this will be, sometimes you don't have picture, only the size. So they can ask this question. Or look at the shape. C is round, no, so round shape. Here also C, so round shape. I is isospora. So if you make it like this, it becomes oval, no? So oval shape. Oval shape with two oocysts inside. You see two oocysts. This is isospora. Okay, that's one thing. Now, next one is another important feature is a cycle will fluoresce, autofluorescence. You call this autofluorescence is positive. Here also, that means both the spora, in spora, autofluorescence is there. Here there is no autofluorescence. Here there is no autofluorescence. That is one point. Okay, size is important. No autofluorescence there. Okay, that's it. These are the main things. Okay, and everywhere you see they all are acid fast. Now another important thing is this. Yeah, because they repeat that, they can ask the treatment. Treatment only for cryptosporidium. See, crypto means currency. Currency. So who is the richest one in India? Nita Ambani. So nitoxanide. This I have taught in my previous revision. Okay? I'm just repeated. Nita Ambani as a cryptocurrency, so nitoxanide. For these two, it is the cotrimoxazole. Okay, they never ask so much, but in case if they ask also cotrimoxazole. Okay, so that's it. So these are the things you should know. Cryptosporidium, cycloiso, these are the basic things. So you know the picture very well. Cyclospora be like it's not properly acid fast. It's irregularly acid fast. They call this is oval comes isospora. Please don't make mistake. You will do it well. And this one. That's it. So these are the important things you should remember in this acid fast parasite. Look at this picture. For long time this pitch is not asked, they can ask. So this is like, they look at this, this is a macrophage. Inside the macrophage, you're looking many things like this structure, like they call it as dia, dia. So this is basically what? A mastigote form. A mastigote form, and that is otherwise called LD bodies. LD bodies is what you know, that is the Leishmania donovani. Leishmania donovani. We have Donovan body, that is different one, that is you see it in the Donovanosis. Okay, that's different. Klebsiella donovanosis, Klebsiella granulomatosis. Not that. This here you're talking about Leishmania donovani, Leishmania donovani. And what is the disease called? This is what is Leishmania donovani caused? What disease? It's usually spreaded by sandfly. You know, it's caused by sandfly or phlebotomus, sandfly or phlebotomus. Okay, both are same indeed. Phlebotomus. Right. Now look at this. This is called visceral leishmaniasis. Visceral leishmaniasis. Why I'm stressing this word? Because this is the other name for Kala Azar. Kala Azar. So you see rapid hepatosplenomegaly. That means liver, spleen, or becoming big. Plus you have what? Pigmentation, hyperpigmentation. That's what it is also called as black disease. Black disease, you know, black disease, black sickness, black disease, whatever. Not the black death is plague, you know. So these are the things they can ask. So indirectly, if they ask this, especially I'm stressing on this picture because it comes, then you have to say this is a visceral leishmaniasis caused by Leishmania donovani. Cutaneous, it's caused by, you know, that is your Leishmania tropica, and mucocutaneous is caused by Braziliensis. Okay, so that is also questions can be asked. So please be ready and careful. This picture I brought because it's a derma question, but in case like this, if it comes and related to all this history they give, this is post Kala Azar, dermal leishmaniasis, PKDL, post Kala Azar dermal leishmaniasis. Okay, that's it. So that's one thing. Now we finished. Okay, this is for the leishmaniasis. Now look at this. This is long time they didn't ask, but if you see anything like this very fashionable like this is called trypanosoma. Trypanosoma. So when trypanosoma comes, only two beautiful people have to remember. One is this is called trypanosoma cruzi. I simply call it as Tom Cruise. Tom Cruise. Here it is this side. Look at this guy. This is a Bruce Lee. This is trypanosoma bruzi. Cruzy and Brucey. Okay, this is Bruce Lee. I put it as Bruce Lee. Cruzy and Brucey. So how to remember? Both are different. Okay. Because Cruzy, you know, Tom Cruise, he likes to kiss. So he likes to kiss. Kissing bug. Kissing bug can be a question. Kissing bug is always ready to kiss. So ready to kiss, ready bug or kissing bug we call number one. Number two, Tom Cruise is a healthy guy. So clinical future would be everything is big. That is what he'll have a esophagomegaly, and he has a cardiomegaly. Also, he can have what colonomegaly. Everything becomes big megacolon. We call this megacolon. Okay, megacolon. All these things, but not the liver and spleen. Now remember, there is no hepatomegaly or liver. Not okay. That question. And look at this. This is called Romana sign. Romana sign. Why this all are? What is the symptoms? Where it takes you? These are the symptoms of American sleeping sickness. Tom Cruise is from America, so American sleeping sickness. Remember, Tom Cruise, American sleeping, also called as Chagas disease. Doesn't matter. Everything Vegas or Chagas. He's coming from Vegas, only Tom Cruise from Vegas, so it's Chagas disease. Okay, it's a revision. I'm just going in a fast manner that you know you will do it very quickly. It's a refreshing your brain. So Bruce, see what you do. He goes to Africa. To meet her girlfriend. Africa to see his girlfriend. Okay, to see. Why I'm stressing? CC fly. Excuse me. Otherwise called Glossina. CC fly or Glossina. CC fly or it's called Glossina. So you get what? African sleeping sickness. He gets African sleeping sickness. Where your Tom Cruise gets what? Tom Cruise gets the American sleeping sickness. All question. Anything they can ask. Okay. African. Now what about this special sign? So this special sign, what is this called? Winter bottom sign. See, these signs are very important. You know this. Water can permeate in your gonococcus and water prediction syndrome in your Neisseria meningitis, that is meningococcus. Neisseria gonorrhea, water can permeate, and Neisseria meningitis, it is water prediction syndrome. And one winter bottom sign also asked some exam they ask. It goes to Bruce Lee. Bruce Lee gets a winter bottom. B for Bruce Lee. Also, you can remember. Very simple. Okay, this much only I'm going to stress. So ideas, remember this stylish wala parasite, if you see, that is your trypanosoids. That's trypanosoid. Okay, trypanosoma, trypanosoids. Okay, right. Next, look at this one. So by looking at the smear, recent INI-CET, they've asked thin and thick smear ka, they've got it, and they asked what is the use, what are all those things. So these are two smear, thin smear, thin smear. In thin smear, what you do, you can speciate. You can speciate. We are here in malaria now. We are here in malaria. So in malaria, to speciate the organism, whether to say it's a Plasmodium vivax or oval vivax or falciparum, or it is Plasmodium ovale or it's Plasmodium malaria for speciating. Thin smear like this, you can see whatever you see, these are all the thin smear after staining. And thick smear is basically to a quantification. You can do quantification, means counting number of parasites. Thick means counting, thick count, thin speciate. This question was asked. Okay, very simple. Now what is the thing you're going to do? They did, which is the stain they've used? What is for all parasites, you do a stain called Romanowski stains. What is Romanowski stain includes? It includes field stain, Jimsha, commonly used as Jimsha only we are using, Jaswanching Bhattacharya, and Brights. So this question also can be, which of the following are Romanowski stain they can ask. So they are field, go in order, F, G, J, W. Okay, order. Field, Jimsha, the Jimsha stains most commonly used. So this is the peripheral blood smear they've given you and tell to identify what is this. So if they say, look at this, multiple ring, I'm seeing the multiple ring, and there's some forms called acoli. Acoli is like, it's like a earphone, acol form. Acol form, okay? And also, look at this. I'm looking a banana shaped banana or crescent shaped gametocyte, gametocyte. So this picture, banana crescent shape, and in female it's intact, in male it's dispersed. Female are organized, they're organized, male are dispersed. So that also. So this is a female one, very organized, and this is a male one, dispersed. Okay, it will be like this only. So doesn't mean they're not that detail, but if you say banana crescent shaped gametocyte, these things. So which Plasmodium is this we're talking here? When this type of picture comes, you already know that is Plasmodium falciparum. Very good. Okay, so this is your this acoliform and multiple ring inside the RBC, and this banana shape all come. This is your Plasmodium falciparum. Plasmodium, the dangerous one, the most dangerous one. Okay, Plasmodium falciparum, all these things. Okay, remember in falciparum, there is no, which stages are not there? There is no early trophozoite, there is no, there is no late trophozoite, and there is no Sejont. Why? This question was asked in a recent INI-CET, because they adhere to the capillaries. They stick to the capillaries and they don't come out. That's what we never see the late of a Sejont. But example, you see down here, single ring, now double single ring, big RBC. See, big RBCs, RBC size is increased. That means it's affecting the young RBCs. Okay, it's basically young RBCs. And you see the Sejont, very beautiful Sejont with merocytes. And then you see a round or oval gametocyte, So these things are characteristic for which one? These things are characteristic for your Plasmodium vivax. So every stage is in the Plasmodium vivax, and vivax, how to remember, is a young guy. So young RBC, so he's big, mota, and then the sharpness dot. I'm not going to, already sharpness dot and moiroids will come in the your Plasmodium vivax. We discussed in parasite. I'm not going to come there again. But the picture, you see a Sejont like this, merozoite are like a like a flower appearance, or gametocyte with pigment like this oval. This is a Plasmodium vivax, and single ring. Only single ring. If you see, then they all are Plasmodium. Okay, that's it. This is one clue for you. But remember, in Plasmodium falciparum, you never see Sejont and late trophozoite stages. Okay. Yes. Now, what about this one? If you see a band, if you're band-shaped gametocyte, that is Plasmodium malaria. Bas, that's it. This much you should know. Okay. These are the questions you can expect. What about this question? This is now very easy. Similar, the clinical features are similar to malaria, but on the blood, this was seen. A cross was seen. See, you see a cross. That is called what? Maltese cross. You see a Maltese cross. Who is wearing a cross? Who is wearing? Babies are wearing. Babesiosis. Babesiosis. Babesiosis is a recently asked question. When you see a Maltese crust, clinical features similar to malaria, but on peripheral blood smear, you're guessing a Maltese crust, that is babesiosis. You're gonna, and you know that it's caused by heart tick, heart baby, heart tick, tularemia, and all those things. Okay, look at this. Now, this inside the your macrophage or PMN neutrophils, everywhere you see this tachyzoids, tachyzoids. Okay, tachyzoids. Tachyzoids means this word actually this spiral one, like a like crescent, small crescent shaped tachyzoids you're seeing. So what are the any guesses? I think already you've guessed, you must have guessed it. What is that? That is basically the, you see in what? Toxoplasma. When you talk about toxoplasma, again here the definite host is who? Cat. Like Echinococcus hydatid cyst, it was dog. Here it is cat. Very common in pregnant ladies. And there's one test called Sabin. Sabina is that pregnant lady. Sabin filament test. You remember Sabina. Sabin filament test. This is Sabin polio vaccine also. Live vaccine Sabin. Here this is Sabin filament test. Sabina, because Sabina is pregnant and she get toxoplasma. Sabina, the girl Sabina is going to help you. Okay, Sabin filament test. Pregnant ladies this thing. Okay, one. And then the baby's congenital toxoplasma baby calcification microcephaly, that is common for everything. That's it. Okay, so tachyzoid is the diagnostic stage and Sabin filament test. If you get a picture, you can write this. Okay, cat is a definite host. Now look at this picture, will be very easy, because all of you know, when you see this, you will say it is elephantiasis. Elephantiasis means it's caused by Osteria bancrofti. Usually affecting the lymphatic system. That's what you have. Cheliuria means lymph in the urine, cheliuria, etc. All those things. I'm not going to talk about that here. And you know which mosquito? Coolies, no? Coolie people, poor coolie people only get the elephantiasis, Culex mosquito. Okay, that is one question. Important is this picture. So look at this. This is a microfilaria in the blood. Microfilaria, they did a Giemsa stain or any Romanowski stain. Microfilaria, the main thing they will tell you, in the tail region, there is no nucleus. That's the thing. See, this is a elephantiasis. The elephantiasis, this is a sorry for my picture. This is this much bada elephant we have. Bada elephant. But look at his tail. There is nothing is there in the tail. But on other hand, if you take the deer fly, which is your Onchocercus volvulus deer fly, there you can see many nucleus. And in Mansoni, Malay, those Mansoni species, you see only 2 nucleus. Okay, that not much. They will ask here only, you see if the nucleus is empty, that is no nucleus, that is characteristic for your elephantiasis. That's it. Okay, not the other species, that will not come. So that is one of the way you will going to rule out. Okay, now next one here. Look at this picture. Now we are here. Parasitology is over. Now we are in mycology. Mycology, 2 pictures. This picture, either this one, the first one, or the second one, definitely you will have a question. Can you guess by seeing this picture? The first picture, what do you think? This is acute angle. Acute. It's like this, no? See, it is acute angle, less than 90 degree. Everywhere you see acute angle. Do you see septa between the species? You can see septa. At least here you can see septate hyphae. Acute angle septate hyphae comes. Already you have a clue. AS, that is your Aspergillus. You should know the stain name. The first one, this is a black color. This is called Gomori methylamine silver. Any silver stain will be black in color. Like Warthin styrene, H. pylori, right? Levadetti stain in your syphilis. So there are so many silver stainings. So Gomori methylamine silver stain is one. Here, when you see pink color, this is a PAS stain. This stain is called periodic acid shift, PAS stain. That's what it is, pink color. P for pink. Black color, Gomori silver, that you know. So this is for Aspergillus species. So when you have acute angle septate hyphae, Aspergillus. Okay. Now, one thing, usually Aspergillus affects the lung, you know that one, different types. Apart from that, you have fumigators, flowers, so many varieties. Niger will affect the ear, everything goes black, flowers causing hepatotoxicity, so many things are there. I'm not going to touch those parts. Now, look at this. In lung, if you see a picture like this that is the aspergilloma, the fungal ball. Aspergilloma, round color with this thing of aspergilloma. This is one thing. Now you should know aspergilloma. So this is the one thing, this question they can ask you. Other one you see is, look at this picture. Here it is, if you see this picture, here it is not acute. Here it is it is not acute. It is 90-degree obtuse angle or wide angle. Wide angled, no septate, wide angle and no septate. You see, there is no septate at all. Okay, there is no septate. The angle is first of all wide, and there is no septate. So this is which one? This will be your characteristic what? If you are saying mucormycosis, you have scored already. Mucormycosis. That's what it is more. I'll tell you what. This mucormycosis mode 2. Remember, wide na everything. M for mucor, M everything is mode 2. No shape. No shape means no septate, no nothing. It's just a motu mucor. In case if you are confused with that. Okay, yeah. Look at this picture. This is very important because what is the disease? It's very invasive, super invasive, fast and super invasive. It's also called as rapid growers. Rapid growers, invasive everything. Angio invasive means it affects the vessels very far. That's what in COVID, what happened? You saw so many people were getting black face and they died also. So this is the one which causes reno-orbital cerebral mycosis. Okay, cerebro-reno-orbital, however you want to take the reno-orbital means first it affects the eye or nose and then it goes to your orbit and affects whole brain. You have blindness, you can have proptosis, so many things can happen. That's what it's more dangerous. Okay, which is most common? Orbitorenal cerebral mycosis or whatever you want, mucormycosis. Okay, that's it. Mucormycosis means these are here. See, the species include Rhizopus, Rhizopus one, mucor is other one. There is no root. Rhizopus has root, and Absidia. These are the few species if they ask. Okay, but you will definitely expect this picture. A wide base, no septate means mucormycosis. But if you have acute angle septate means aspergillus. Bas, very simple and easy. Now next one, look at this picture. This picture, so definitely you expect every year there is picture. Okay, this is the only capsulator. This is Indian ink. You see an Indian ink and you see a capsule is positive. So when you see this capsule positive bacteria, well, they give if it is a mycology from fungus, capsule positive, and usually they say meningitis. Usually they cause meningitis in CSF sample. This came, or sometimes not necessary. The primary organ is lung only. The primary affection is lung. They can give. Then after spreading, it causes a meningitis in HIV patient or immunocompromised patient. If they give you, you have to think about what? Cryptococcus. Cryptococcus neoformans. That is, this is the pigeon droplet. No? Pigeon drops because of pigeon drops. So this is the identity. Now, which is a rapid test, which is the test immediately you get the result, or best or rapid test means you have to choose this called rapid card test. Rapid card test, that is lateral flow assay. Okay, lateral flow assay is the best and immediate test. You can get positive. You will be seeing the line here. You can up and down the species. Okay, so that's the one. If you want a fast result, you go with the card test. Okay, rapid test. That's it. Lateral flow test, you can say. Okay, right. This is a musicarmine. In musicarmine of the tissue, you can see this inside. You can see the buddings, because cryptococcus is what it's a yeast. It's a pure yeast. There is no mold form, only yeast. Okay, that one. And same thing, what is this one? This again a fungal stain. It's a fluorescent stain. So this one, calcofluor. Calcofluor will glow like this. Calcofluor stain. It's a fluorescent stain. Like acridine orange for malaria, and auromin rhodomin, it is for your tuberculosis. Okay, right? Same thing. And this is a bird seed agar. Because cryptococcus I told, so it's a bird seed agar. You can see brown color colonies are growing here. These colonies are growing. That's it. Okay, these all about this much only you should know. Okay, meningitis, HIV patient, musicormine stain you get like this, and this is a capsule. See, it's only capsule. There are few, but most common is this only. And calcofluor white. It's a calcofluor white stain for fluorescent bird seed agar. Cryptococcus over. This picture also expected. Recently, they were not asking. Now you can expect. So what I'm saying, this picture, this is an oral thrush or oral candidiasis. This is a vulvovaginal. This is, you see, curdy or cheesy discharge. Curdy discharge. In Trichomonas vaginalis, it was which discharge? Green color discharge. Here it is a curdy white discharge. Curdy or cheesy, both all are right. Okay, discharge. Vaginal discharge. Okay, vulvovaginal. So what is this one? So when you have curdy white discharge, and also this is yeast or yeast-like growth. In which agar? SDA agar. You know that SDA agar means the pH is very important. They asked a question. S looks like a 5. So it is 5.6. Easy to remember. That was the question. So cardiac discharge, normal STS agar ka 5.8. So this cardiac discharge with the pH will be less than 4.5. Acidic pH comes. So this clinical diagnosis will go towards your candida. Candida. Okay, remember your diagnosis will go towards the candida. Okay, now next one, this is a candida. Now this will be here. If you see, this is a chrome agar. Chrome agar is to speciate according to the different color. So you will speciate candida albicans, parapsilosis, glabrata, so many species. The most resistant one, that is your cruzi. So many things. Auris, sorry, candida auris, more resistant one. Okay, now what is this one? This picture, if you see this picture, what is this picture? You see this one. You see a something like a germ. You put in a plasma. You see a germ tube. Germ tube. Okay, germ tube. Because candida has what? Candida is a budding yeast cell plus pseudohyphae. Budding plus pseudohyphae. No? Just pseudohyphae. Apart from pseudohyphae, we see a germ tube is positive. That is candida albicans. Especially candida albicans. To speciate, we can use this one, candida albicans. Okay. The phenomenon here, germ is called Reynolds-Brody phenomena. Reynolds-Brody phenomena. Reynolds-Brody phenomena. Okay, these are the other few questions they can expect. Okay, you can expect. Look at this. This is a beautiful picture. Expected. Surely, you will have question from your everyday missus. Where we are, these are dermatophytes. Dermatophytes. We already discussed many times here. Dermatophytes are basically the ringworm infections. So ringworm infections are caused by 3 species. One is this is trichophyton. Trichophyton. Okay, this is second was epidermophyton, and this last one is microsporum. These are the 3 things. Now you should know first of all which one affects which organs. If you know tri means all the 3. That means your skin, hair, nail. Skin, hair, nail. Epidermophyton, see, skin is always everywhere. It's a skin, definitely because it's a skin infection, skin. In epidermophyton, N is ending, so it is nail, skin and nail. Here, sporum, micro means hairs or micro, no? So skin and hair. This is a question. Skin and hair, micro hair. Everyone these days having your hair is falling down, so we have micro hair. Okay, fine. And microcondia. When you talk about microcondia, the only place where you see large microcondia is trichophyton. Microconida is not seen in microsporum. Everybody thinks conidia. C-O-N-A-D-A, conidia. Microconida is positive, more abundant in trichophyton only, not in microsporum. Rest other is absent or not seen. Okay. But in the picture, what we have now is what is that? That is your main thing. This is a macroconidia. So what type of macrocondia you see here? Pencil tip in trichophyton. That means how to say, first of all, when you're a child, you always try to write with pencil. You try to write not directly pen. You try to use with a pencil. So pencil means trichophyton. Very simple. You don't have to think too much. Don't make a lot of mnemonics and confuse yourself. First time when you start as a baby, when you start to write, you write with a pencil. So pencil tip macroconidia. I'm talking about macroconidia. Macroconidia will be your trichophyton. Epidermophyton. See, all these people call Ebi. You know, if you go to Chennai or Hyderabad, wherever, these people usually own a club. They always have a club. Ebi, you cause Ebi or these rowdy guys, they usually have clubs. Okay, so I would say club shape. Look at this. This is a club shape. When the word club shaped comes, this is a club shape. Club shaped macroconidia. It is your epidermophyton. Very simple. Ebi owns a club shaped. Very simple. You don't have to use your brain. But this is not, you know, the revision also. You know, you just remember like this, how crazily I'm remembering, you know, that way you will not forget it. Believe me. Okay. Yes. Now, next one is your microsporum. For microsporum, we have a spin. We have a spinners for in microbiology. Everything has to be spinned. Any serological test has to be spinned. So spindle-shaped microsporum. Microsporum is spindle-shaped. In micro we spin the things. We spin a lot of things for doing tests. Microbiology. So microsporum, spindle-shaped macrocondia. Finish. This much only. Okay, look at this. It's looking like a spindle. Here's a club and here's pencil shape. That's it. Why you're worried? You will really, smash it. I know now by this time you guys must be more confident, and I'm glad that you are very confident. I'm sure you're going to do great, great, great. Okay. Now look at this. This one, it's definitely beautiful. Look at this. Who is this? This is our mala. This is our mala. Okay. First of all, look at this. This is our mala. Okay, I call her pity. She's very pity. You know why she's pity? Because she loves to eat the meat and spaghetti and meat. SPAG, spaghetti and meat. Also, sometimes she eats banana and grapes. Banana grapes. Poor girl has this thing. What she has? She has pruritic, means itching pruritic pruritic or hypopigmentation in the trunk part, itching, fungal infection. No, so what you can expect? Of course, you'll expect that itching only. So what is this, sir? Mala, pity, what is this? Yes, you know this. This is a Malassezia furfur. Okay. So now I'm going to write it here. So this one, Mala, because this organism name is Malassezia furfur. What it causes? This disease. Pruritic and trunk, all this thing you're seeing, no? That is called pityriasis or tinea versicolor. Versicolor. Question. Meat and spaghetti ball appearance. Look at this. In the LCPB is lactophenol cotton blue for fungus only we are doing. You see all the meatball and spaghetti appearance, or banana and grape appearance. Very simple. Banana shaped, crescent shaped gametocyte you see in the Plasmodium falciparum. That is Moirot's small Chinese dangerous guy. He eats bananas. And grapes, grape-like cluster in Staphylococcus aureus. Staffs like grapes. Okay, right. That's it. And protic hypothelium. Finished. Okay, now, yes, look at this one. This one now, again, this was for dermatophytes only. This is a type of tinea. This is a tinea capitis. This is all of tinea capitis. In tinea capitis, you have many things. One condition is called fovus. It's very scaly. You see this picture, they can give you very white, scaly. Who is this person I'm seeing here? This is fovus and this is kirion. This boggy swelling is called kirion. Kiri, kirion. Kiri play in Tamil, when kiri play means it is some that goose, which fight with the snake. That is kiri. So same way, your head also looks like something has bited, kirion. Okay, boggy swelling is there. Now, what I'm going to do here is that, yes, this is who is having this fovus? Our Shonali benthre. That is Trichophyton Schonleini. Okay, Schonleini. Trichophyton Schonleini. Okay, Schonleini. This will be question. Who is favorite? Fovus favorite. Who is everybody's favorite? Our Shonali benthre. Okay, Shonali. Trichophyton Schonleini. Okay, Schonleini. Carrion is caused by, see what Anushka is doing. This Anushka, something she's doing to this our Viru, Trichophyton, Viru Kosum, and he becomes mental. Viru becomes mental. Mentographites. Verrucosum, and mentographites. Question. Carrion is caused by the question. Fovus is caused by, both are tinea capitis, which is caused by, one is two. If this is scaly, remember Shonali benthre. If you see this carrion, remember our Virat Kohli. Viru, and he's a mental. Viru become mental. Okay, because of this disease. Okay, that's all. Now look at this picture. This picture is very interesting. This is the Jock's itch. This is called Jock's itch. It is basically tinea cruris. Usually it is everyone, we have it in the summer. Unilateral along the thigh side itching. That is the clue they'll give you. That is Jock itch caused by tinea cruris. We call it as tinea cruris. What about this? Is athletic foot. Athletic foot also in summer time usually happens. This is called this is tinea pedis. And manu means finger, and corporis means in the body. Those things I'm not talking. Okay, that's it. So these are the few pictures they can ask. Okay, now next one. If you see here, this is your this is a swelling with this is swelling plus discharge. So, and you have a granules, different type of granules will be there. What is this disease? This is characteristic for mycetoma. Mycetoma can be actinomycetoma or eumycetoma. Actinomycetoma bacteria, eumycetoma E, and after E comes fungi. So that I'm not going to talk. But one thing I want to talk is this. Now we are in which fungus? Subcutaneous. We are talking about subcutaneous subcutaneous fungal infection. Subcutaneous fungal infection. We have subcutaneous fungal infection. We have shortcut is MRCS. We have to do MRCS if you want to know subcutaneous. M for mycetoma, number one. Now, number two is MR will go. C is there. C is basically what? C is your, look at this picture and tell me what is this picture. This picture was recently asked in one of the exams. You know very well. This is called, this lesion is called varicosa dermatitis. Varicosa dermatitis. It is what-like lesions, not what, but it's what-like. What-like. Usually they give you forest worker who has this what-like lesion. What is the diagnosis they'll give? And they will say you on the biopsy, this was seen. What is this one? This, it looks like some point, that is copper penny, or we call sclerotic body. I think you already guessed. Or it's called medlar body, medlar body, sclerotic body, or murriform cells, murriform cell. We forgot MMS, okay, MMS, murriform cell, shortcut is MMS. This picture will definitely, you can expect. And what is the thing? It is basically chromoblastomycosis, chromoblastomycosis is the diagnostic feature. Very simple. Okay, chromoblast. Everything gets blasted here. And because it's forest, the costive agents are, Fmge, Fialophora, Fialophora, Fialoflora, like four forest in a fee, four Fialophore, these type of things only. So this picture, if it comes, you are going to score. No doubt in it. You're going to score in a very high marks. Okay, next one. Now look at this. Third subcutaneous infection. MR, I told you. So R, before going to R, now tell me what nose is this? Strawberry nose. When the word is come, just the strawberry nose. And if you made a biopsy, you see the spirules you see the spores in the spirules. This is a spirule with a lot of spores inside. That itself gives you a clue. What is that? Rhinosporidium. Rhinosporidiosis. It's Rhinosporidiosis sea berry. We call it sea berry because it's usually seen in the South India. South India, wherever this pond, contaminated pond and all in Tamil Nadu, there you can find it. So that clue, if they give, easy, you will get this answer right. Okay, Rhinosporidiosis. Next picture, so you have to know, and it is always asked. By seeing this ulcer only, what you're going to say now? This is the row of ulcer. You already guessed, right? I know that. Row of ulcer along the lymphatics, and the person is a gardener. The person is a rose gardener. He's a gardener, rose gardener. And this special phenomena, you see like a star, Splendor Hopley phenomena. This basically, it's a type of allergic reaction, Hopley phenomena. Here you can see like, like a sun ray goes, that's the Splendor Hopley phenomena. And second one, if you see the conidia, it is like a rose-like conidia. Or sometimes you call asteroid body. So when this one comes, what is the thing you're going to think? I know that you already thought it is gardener. And yes, I forgot this also, sometimes called cigar bundle. You call it as cigar bundle appearance. So these all are going towards what? Sporothrix shankai. So dimorphic fungi also, and it is a subcutaneous fungi. That's important. That's why I'm stressing MRCS may sporothrix. It's dimorphic also. It's causing subcutaneous also. This question can be asked. Definitely asked question. That's what I'm marking this. Okay. So rose gardener brand, asteroid body, because nighttime is the asteroid, and the gardener will smoke cigar. This all I have explained very nicely. And he has a splendor bike also. This all we have it in the previous revisions. I'm not going to stress it too much. Next one. Look at this. Here, look at this. Now we are in which one? Dimorphic fungi. Dimorphic fungi. If you see, You know that one. I always told you to remember. Hit, blast, cock, paracock, pen. That much only. All dangerous things will come in time of their systemic fungi. Usually the most common affector is lung. So they will give you first, this is the first organ. Look at this. This is actually it's intracellular, but then it is very tiny, tiny budding yeast cell, tiny budding yeast cell. That is to you have a narrow budding. That means like this and it's like this. There is narrow budding, okay? Tiny budding yeast cell. And when you talk about this form, when the mold form, dimorphic means one is yeast form and mold form. In mold form, you see tuberculate conidia like this. Okay, so this first one, this is the first organism. I'm just going to put this one here. Okay, tuberculate conidia. And what happened? This disease is similar to TB. This is the exam. You'll get a question like this. Similar to TB, TB, tuberculate conidia also TB like, and this TB, tiny b. So which is the organism they will ask? So what you're going to answer? If you're going to say it is histoplasmosis, you got it right. Histoplasmosis. This is the only thing that is endemic in India. Dimorphic fungi, you know that. So histoplasmosis, what say? See, I'll put out a caveman here. So this caveman, he hits with his wife in a cave, Ohio cave. So it's a cave's disease. You call it cave's disease. You also call Ohio disease. Also, it's called darling. So this caveman with this darling in a cave, they're having fun. So darling disease. These are the name for histoplasmosis. Okay, darling disease. Okay, you can ask anything. So at least in picture, you see this tuberculate macroconidia and then this tiny BYC narrow. And then give you pick. Don't think they will give history of bat also in cave. Maybe you have a bat and all these things comes. You will mark this only the symptoms of TB. They give histoplasmosis. Look at this picture. Second one. Very, very simple. What does the picture says? Any idea? What are you going to guess? It is like figure of 8. It's a figure of 8. No, figure of 8. Because it is what? Broad-based budding yeast cell. Broad-based budding yeast cell. So broad-based budding yeast cell, this thing comes. You know what is B for B and 8. Everything looks so B for blastomycosis. Here also lung will be affected, and if they give in the picture, this was upset and this blastomycosis. Blastomycosis, this is Gilchrist disease. Other name is Gilchrist. I told you when Gilchrist wins the cricket match, he goes to Chicago and he has this which Chicago disease or Gilchrist disease or blast. He's going to have a blast in Chicago. Gilchrist when he wins the cricket match. Okay, that's it. Now, next one is the third one. So one hit is over, blast is over. Now look at this cock. So what is this cock is doing here? This cock is sitting on a barrel. The cock is sitting on a barrel. Okay, barrel. This cock name is actually called Arthur. Okay, so what is the magic here? Cock? Coccidiosis. Coccidiosis. This coccidiosis, what is the characteristic which you see a barrel-shaped arthrospore? The conidias are called arthrospores. This is what barrel shape. This is a barrel shaped arthrospores, and you have a spirules like this spirals where the cock is eating on the spirules. This word comes, this picture comes. You will think about a cock is this with the see. These are the arthrospores. Arthropod is like this. It's a rectangular or barrel shaped. You call rectangular barrel shape. That's what arthrospore. Okay, when you see this one, please remember arthur means cock. Cock name is Arthur. This cock name is Arthur. It's on the barrel and then your spirules. That's it. Very, very simple. Now, next question here. Now the fourth one, cock is over, then there's the bell. This is cock. But cock, this is a cock. On the side of the cock, if you put extra, then it becomes paracock. So this is paracoccidiosis. In paracoccidiosis, remember, okay, this is a cock. If you put many things, it becomes paracock. So very, very simple. So paracock can be like this. So there are a lot of names. This one is called any wheel. You know, they call it as the pilot wheel. Pilot, sailor. Okay. Pilot wheel, sailor wheel, any wheel. The word wheel comes, you think about paracock, wheel-shaped appearance. Okay. Or look at this. It could be like a Mickey Mouse. Very, very simple. Mickey Mouse. Okay, it's very, very simple. Cock, if you put something on the side of the cock, it becomes paracock. So put side all these things. So get sailor, pilot wheel, sailor wheel, Mickey Mouse. Everything is a Mickey Mouse appearance of this budding is that's it for paracoccidiosis. Now the last one. The last one is your and sporothrix also. I told you it's a dimorphic function, but we already discussed subcutaneous. So we're not talking about this here. Look at our favorite Talai. It's not Ajit, we call it as Talai. Okay. So Thalaromyces. Thalaromyces. Talai likes what? Pen. He likes to write. So penicilliosis. Penicillium marnifi. We also call it Penicillium marnifi. Okay. Okay. So what happened? You know Talai's favorite color is red. Everybody know, even as all South Indians, they know Talai very well. And his first movie, one of the movie was red. So what? Red color pigment. Red pigment, if this is the only red pigment producing Anjay, look, he likes his favorite, Ajit's favorite job apart from bike driving, he do painting. So paintbrush. He has paintbrush or broomstick also we can. Sometimes it looks like a broomstick. He can use as a broomstick also. Okay, paintbrush or broomstick. What he does, he's having suddenly one day this bamboo rat entered inside his house. Bamboo rat entered his house. Oh my God, he got so angry and he hit this bamboo rat and then it became red color. The bamboo rat's butt become red color. Remember like that, right? So red color pigment, if you don't forget the red pigment, you remember Tale was hitting this bamboo rat with his brush. And then what happened? The bamboo rat got red color, nice pank on the buttocks. Okay, remember, red color. So very simple. You expect this question, 100% guaranteed questions. So there is no other picture in micro. We have only this much, and this much you have to know. Okay. Now, last one. Oh, this is not, I'm sorry, I'm not going to put 6 because this is not dimorphic fungi. It's a different fungi. It's one of the systemic fungi, but not dimorphic. What is this? This is Pneumocystis xerovici. Pneumocystis, this is only one totally different type of fungi. Ideally, it is should be a parasite, but somehow, you know, due to genetic thing, it is put it here. So here, what happened? You see the black color, this cyst which you're seeing, black color, that is the cyst. And how does it look like? Ping pong ball. Ping pong ball, ping pong ball, ping pong ball, ping pong ball. Okay, very simple, ping pong ball. And this green color, they are the trophocyte, not that important, trophocyte. And you know that they affect they cause the pneumonia. Pneumonia in which patient? HIV patient, when your CD4 count goes less than 200. Like along with the toxoplasma and cryptococcus. Toxoplasma and crypto. They all affect when the CD4 count goes less than 100. We already discussed that in the only thing is ping pong ball. You have to remember this black color ping pong ball you're seeing here. All these things are Pneumocystis xerovicis, Pneumocystis carni. Okay, that's it. Now, next one. Now, different shapes of viruses. Now we finished mycology also. Only that much picture is important. You should know. Now we are in virus. Virus we know very well. I'm going to very super quick. So this is a bullet chip. You know that bullet chip means, you know which one? Rabies. So rabies virus. Rabies virus, if we have a bullet, just when any dog is having rabies, what they do? They used to kill with a bullet. Okay, rabies bullet. This is like a dumbbell. It's a brick shape. First of all, outside it's a brick. Inside with you have what? A dumbbell. Who is this one? A brick and dumbbell. I told this is a pox. Your pox means Henderson Peterson, our Spider-Man Peterson body. So he got a pox and then he's very strong. He has a brick to throw. He throws brick to anybody. He's very strong. He's a Spider-Man, no? Remember like pox. This is a space vehicle. Space vehicle, I always told you who was vehicle. Our Adnan Swami, adenovirus. Adnan Swami is a very, very rich guy. He has even the space vehicle. That's it. And here what happened? Cartwheel. It's like a cartwheel. One cartwheel we studied just before, that was a paracoccidiosis. Another cartwheel is your rotavirus, because rota also you're rotating. Your rota means rotate the car. So rotavirus cartwheel. Okay, got it? Yes. Now this one, star, it looks like a star only. So star means then the virus name also something like that. Astrovirus, astrovirus. Okay, look at this, filamentous. So if it is filamentous means we don't have F and E is near. So it is Ebola. This question you can expect this time. Okay, Ebola, bat, fruit bat. Now, this virus, so you know, barbar, everyone knows, you've seen it many, many times. So only thing is that you see flower petal appearance. You see flower petal papillomer. flower petal appearance, papillomer means it is characteristic about your coronavirus. Okay, that's it. Well, look at this picture. This picture again, I know that you must be like already knowing it. You're like, sir, I know, and I can hear that you're saying, sir, we know that, but still I'm going to revise it. So this is called herpes labialis, herpes labialis. It is in the lips, labialis. This is herpes gladiatorum. Gladiatorum means this is a restless. Restless, they hit on the face directly like this, no, because of that. And this is on the lips. This is a dendritic ulcer. You can see dendritic or geographic ulcer, you call dendritic ulcer. Okay, ulcer. So these all are characteristic for which one? Your herpes simplex virus 1 because above, so this step is herpes simplex virus 1. And I'm not going to talk about that. It causes the temporal lobe encephalitis and all. That is we have discussed it already so much. Not now. So no, this is in the genital region. Genital painful. They'll give you this picture. They say painful ulcer or vesicle is seen. That is your herpes simplex virus 2, HSV2. That's it. Okay, 2. So now look at this. The common thing is this question they can ask is this question. What is this question? They're going to ask you this one. Identify this. What is this? You have a giant cell that is called multi-nucleated giant cell, MNGC cell, multi-nucleated giant cell, multi-nucleated giant cell. So this is what smear? Sang smear. Sang smear, they stained with Ginseng, and then you seeing this one. So this is usually see, it could be what? Herpes simplex virus 1, 2, or it can be varicella zoster virus also. In all the 3 you can see. Okay, now look at this one. So this is the multinucleated giant cell picture. This picture comes, you know, this is chicken pox. Chicken pox, because you have what lesion? Pleomorph, different type of lesion, pleomorphic lesion. It starts pleomorphic and centripetal, which starts in the central part of the body and goes to the centripetal. These are the 2 characteristic words, pleomorphic and centripetal chickenpox. Finished. But the same thing in adults and children. But in adults, when it is reactivated, that is called shingles. So these all are which virus we're talking here? We are talking about the varicella zoster virus. This is varicella. I'm sorry, I want to change the color of the pen. So what we're talking of here all are the varicella zoster. Varicella zoster or herpes zoster. All same only. Herpes zoster, varicella zoster. Okay, they're same. So shingles. In shingles, what is important in shingles here? You should know that in shingles, it's unilateral, and what the main thing is what? Post-herpetic neuralgia. Post-herpetic neuralgia will be asked. You have to gabapentin. Okay, painkiller, gabapentin, pregabalin. You can give us a treatment. Okay, this one. And this one, you know, one side, if it goes this, it's a Ramsay-Hunt syndrome. Ramsay-Hunt syndrome. One side, seventh nerve paralysis comes. Okay, that's because of geniculate ganglion. I'm not going to talk all those things are not here, but just only the pictures we're talking. This is Justin Bieber, but then he also had this thing, no, herpes. He had a chicken pox, and then he got all these things. Okay, that's it. Now, next. What is this one? This is the limb hypoplasia, and then cicatricial or scar skin lesion, scar and the skin lesion, baby. So this is basically congenital varicella, chicken pox, congenital varicella syndrome. Remember this, okay? This is congenital varicella syndrome. This is a question they can ask you, okay? Next, this one, you know, this again, next virus, it is easy and everyone must be like very much easy with this. This is the Reed-Steinberg cell. Reed-Steinberg cell. So this is related with the Hodgkin's lymphoma. You know that Hodgkin lymphoma, Burkitt lymphoma, all these things, okay? And even your nasopharyngeal carcinoma, gastric carcinoma, and this picture is the oral leukoplegia. We already discussed if this comes, which virus is a pulmonary test also you, that's your Epstein-Barr virus, EBV, okay? EBV, Epstein infectious mononucleosis, and all these pictures can be given to you, okay? I'm not going to talk pulmonary test, already you know that, okay? Now this one, what is this? Oh, our Kejriwal ji is here. So what is he doing here? So this is a chief minister. He is having a owl, plus sometimes he give pizza to all Delhi people, you know. Okay, you got it. So C means I'm talking about CMV virus. CMV virus, which is the catalytic body owl eye inclusion body, owl eye inclusion body. Okay, this question will come. Look at this. This is basically pizza pie. You know, pizza pie appearance. What happened in HIV patient? In HIV patient, when the CD goes less than 50, you get what? Retinitis. Retinitis. CMV retinitis is commonly caused by, retinitis caused by your this thing. CMV virus, so pizza pie appearance. So this is, remember, okay? Owl eye, pizza pie, retinitis. It is one question. Sure, it's not easy. You're not going to miss. CM may what is CM? Our CM has owl in his home. Okay. Now what is this one? This is a vascular tumor, blue color vascular tumor. That is Kaposi sarcoma. Kaposi sarcoma, but they might ask you directly which virus is causing. That is caused by HHV8. This is also causing effusion lymphoma also. Not that much, but HHV8. Kaposi K, if you make little bit tilted, you will become like a 8. Like budding is cell, broad budding is cell for blastomycosis, budding figure of 8. Same way, K ko twist karo, you get 8. So you have so many links, you know. That's what micro is so easy. Don't have to use your brain. Okay, all you have to use is some concept. That's it. Not concept, just make crazy way how you want. So this is basically a what, a plantar what. So whenever you talk about a what, the only virus which come to your mind should be human papilloma virus. Okay, it doesn't matter. See, one to the different. One is a deep, and the 2, 3 is called plantar what, superficial what, and especially HPV 5 and 6 cause Treeman syndrome that we discussed. But remember, it's HPV. Now here, look at this. This is a watch, no genital watch, but it's called condyloma acuminata. The word comes condyloma acuminata because acuminata, not lata. Lata is syphilis. This is acuminata. So this all comes. Then this is genital watch. You know, genital. This is all a genital watch. Okay. So this comes. This is caused by your HPV. Which species we're talking here? We're talking about your 6 and 11. Anal what, laryngeal papilloma, these things come, these all are caused by your HPV, human papilloma virus, don't forget, okay, this thing. And of course, cancer is caused by cervix cancer. When you talk about cervix cancer, that is your 16 and 18 HPV. This is some special cell, you know, the racinoid cells. It's like racinoid cell. This is who likes raisin? Coccyla, coilocyte. These are the coilocytes. These are especially seen in cervical carcinoma. Only you see it in the cervical cancer, which is caused by the protein E4 and E5. E4 and E5. Okay. But coilocyte means coila is a girl, cervix cancer due to HPV. She got the cervical cancer. That's it. Okay. That's it. Now look at this. This is very interesting. Yes, let's cut this. First of all, whenever I say this is a Peter Parker means it's a piece of Spider-Man, you know, Spider-Man. So as I told always in Spider-Man, umbilicus, what will come? You see this, there is a umbilicus, umbilicated lesion. So this umbilicated lesion with cheesy material coming out means, that is which one? Pox, I told. Pox, the big pox, the brick shape. So, you know, Spider-Man can do anything. Peter, why Peter? Henderson-Peterson body. Henderson-Peterson. Henderson is Peter, Henderson-Peterson bodies. Okay, that's what I was stressing on this. Pox virus, umbilicated lesion, pox virus. You know this one, easy. So that also you not make mistake. Now here comes a sad story. Everyone knows this again. I don't have to say this is our Paru. Paru means Parvo. Parvo. What happened? Why she is, first of all, she is small. She is very frustrated because she's small and she's single. Why single? Because there's the only single, usually double standard, but there's only single standard DNA viruses. Okay, that's all. Single and so she's frustrated. So what she do? She slaps the, she slaps with the frustration, she slapped the children. So the baby gets slapped cheek appearance. Slapped cheek appearance. Okay, this is also called erythema with 5 fingers, you know, with 5 fingers. So 5 is 5th day disease, you know, 5th day disease, 5th day disease, 5th day disease, erythema infectiosum. If you forgot also, F for 5 is there, F infectiosum. Okay, erythema infectiosum. This is all be question. And of course, it causes non-immune hydrops fetalis, non-immune hydrops fetalis. Immune one is caused by Rh incompatibility. You know this, but when non-immune hydrops fetalis, it is caused by your this thing, your parvovirus. Okay, parvo. This all goes to which virus? You are, I'm going to change color. This all belongs to parvo. It causes aplastic crisis. You know that aplastic crisis, aplasia, all these things is caused by your this thing. Okay, RBC, aplasia, everything. Okay. Now look at this virus. If they give you a virus like this and tell to identify, suppose you should know, because there are three: spear-shaped, filament-shaped, and Danny particle. When the word Danny particle comes, you should know this. Which hepatitis it is? Hepatitis B virus. We're talking about hepatitis B virus here. And then if they just give only picture, how to identify? See, because you are seeing different surface protein is there, and then you have a central core protein, and then there is something called in between. You should have they haven't mentioned it here, E protein also. Okay, E protein. So these three proteins should be there. Then that is hepatitis B. So Danny particle is basically hepatitis B virus. Okay, if you have like all these three protein, easily you can find it. That's it. Now, one question frequently asked in hepatitis B virus profile, they might give you and tell you, identify. See, the best initial period may best is PCR. Incubation period itself, if you want to identify hepatitis B, you do PCR. But after some days, after 4 to 12 weeks, then acute infection starts. The first one to increase would be HBS. That you know, this HBS will be the first one to increase. Then after that, for antibody to this antibody to HBS to happen, it takes time. It takes time. Whereas there's a time. So there is a period called window period. So in window period, which is the best one? That the question asked is, in window period, which is the best? So in window period of hepatitis B infection, the best one is this one. Anti-HBcIgM. That will start to rise. So in window period, just this one, this blue color mark, this could be a question. That's it. Okay. The best in the initial stage is PCR. PCR is the best in the initial stage. And the first antibody to rise would be HBs antibody. First antibody is HBs and first test to diagnose. The first in the serological, the first was HBs AG only. But for HBs antibody to rise, it takes a time. So during that window period, the best would be HBC IgM, acute infection. You know that. Okay, that's it. So this is just to say, in window period, HBC IgM is the only marker you have. Okay, that's it. This is what I want to stress. Rest all we have discussed already. And look at this picture and tell, just fast. You see, don't worry about all outside things. See the inside, you have two RNAs. Very rare. Usually always single RNA, but you have two RNAs, and then you have reverse transcriptase enzyme and this GP2041 envelope proteins and where is P2417, that is a GAG gene protein. So this two RNA and reverse transcriptase is there, means itself, you know, it is a HIV virus, human immunodeficiency virus. That's it. This one question. Okay. Plus reverse transcriptase, reverse transcriptase enzyme. That's it. Okay. Now, next one. Look at this virus. You have how many segments? If you go 1, 2, 3, 8 segments. When you have 8 segments of RNA, sometimes it could be only 7 segments. If you have 8 segment RNA, it's basically your influenza virus A and B. C will have only 7 segments, but if it's 8 segment, it is A and B. That's it. You never know. They can just give you to identify, you know, because they want to test you. Neuraminidase hemagglutinin protein is there, but without any marker, just they give this until to identify. If you have so many segments, you know, I told you, segment, who is segment? Ortho guys have 6 packs. You know, they have 6 pack, 8 pack, 10 pack. How many packs you want? So ortho means ortho influenza, because ortho guys have flu, influenza. They always sneeze. This ortho guys. They are 6 pack people, but no immunity. Okay, remember like that, ortho guys. This one, you know, this is a mumps. Parotid swelling. Okay, parotid swelling is there. That's what it is, mumps, I said. So it's the first one. Second one, you know, when you see the rashes in the palms and soles, if you see the rash, and then your full body rash you have, that is one thing. And look at this spot. Look at this spot. You see what? This is a Koplik spot. Koplik spot. This is a Koplik spot. And from there, if you make a smear, if you see this one, Warthin Finkitli, KEDL, Warthin Finkitli cell. So what is the thing you're going to think? You're going to think, see, Koplik spot usually happens on the 12th day, you know, and then the palms and here the rashes happens on the 14th day. Initially, so this type of symptom, the Koplik spot, Warthin Finkitli cell comes, this is your Which one? Your measles. Okay, mumps. And incubation period is usually 10. The disease is 10. For mumps, the incubation period is 19 because it's big mum, so everything goes later. Okay, right. Now next one. This is the now this one. This is basically Forshimer. Forshimer spot. When you see Forshimer, there's R. So here also one R is there. R for rubella. Okay, rubella. So this is rubella. Forshimer spot is for rubella. That question can come. You see blueberry. This is a congenital rubella syndrome. I always say when you get a rubella, go to a CCD. CCD, no, because CCD is, I'll tell you what, congenital rubella, the rash is congenital rubella or rubella syndrome. So you have what CCD means. They have cataract and they have cardiac defect. We already talked many times. PDA, patent otosarcoidosis. D for deafness. With that, they have this blueberry muffin skin. Blueberry muffin rashes. Okay, blueberry muffin rash. So if you have congenital rubella syndrome, go to CCD. That's it. Okay, remember like that. Okay. Now the next one is, look at this. So dog bite, dick bite, they'll give you and they'll give you in the CNS, the patient has this aerophobia, hydrophobia, or dog bite, everything. And then they give you CNS picture like this. You see this inclusion body you're seeing here. These are called Negri bodies. So Negri body means it is your Negri bodies. When you see in the CNS, hippocampus or somewhere, what stain you do? Cellar stain. You sell the rabies dog, no? Rabies dog. So that is, when you do the stain and you see Negri bodies, it is rabies. Okay, that's it. Not much. So you see all this stain like this, no? Those are Negri bodies in CNS system. Okay. Yeah, hippocampus or cerebellum. You know that one. Now look at this. So this is a rash on the your both the elbow region. So that is basically tourniquet test. Tourniquet test, okay, tourniquet test. So basically, where you do tourniquet test? In your dengue fever. And what happened when you tie it? You should have more than 20 petechial rashes per cubic mm. You should have more than 20. So in this region, what they've given is, if they say this is a tourniquet was done, identify which disease, you should say dengue fever. Dengue by flavivirus. Okay, that's it. Next. This one, respiratory symptom, and here they will arrow mark is given. Look at this, like a steeple sign. Steeple sign means, steeple sign, or it's like a temple, a church tomb steeple. So who is the one that always do prayer in front of the tomb? That is, I told you, in a crop, he's sitting and he's doing yoga. That is croup means crop. Who is doing that thing? The croup is acute laryngotracheobronchitis. Who is doing parainfluenza? Paramamsa. I told paramamsa, parainfluenza. Paramamsa, if you from the old revision picture, you can see that paramamsa sitting on the crop. Croup means crop. Croup is basically acute laryngotracheobronchitis. Acute laryngotracheobronchitis croup, which is caused by parainfluenza virus. Question will come. Definitely come. Okay. One is here, other one is your epiglottitis. In epiglottitis means it's H influenza virus. Okay, we no need to worry about it now here. Now we are going to the bacteria. Wow, we are in bacteria part. Bacteria, you should know only few things. So this one, let's say this is the ulcer, but then it was painless. So that's a hard chancre. It's a hard chancre. That means no pain. Indurated hard chancre, but no pain is a clue. So that's a primary syphilis. Okay, this is primary syphilis. What about the secondary syphilis now? Secondary syphilis, you have rashes on the palms and soles, like measles. Your palms and soles, you have a rash. Okay, typical rash. They definitely asked question. They will ask you palms and rash. And second, this, or you can have condyloma lata, not acuminata. Acuminata is HPV. This is condyloma lata, just condyloma lata. This region they'll ask. Okay, secondary syphilis. Now, what are the basic? This is if they give this picture, this is a dark field microscopy. You're seeing spirochetes, dark field. Spirochetes was seen, they'll give you. So it is again. So syphilis is caused which one? Treponema pallidum. And there are two tests which is non-confirmatory or just a screening. What is this? VDRL test And this is your RPR antigen test, RPR, rapid plasma rain. Both are just screening only. Okay, screening. And VDR is good for your CNS also, neurosyphilis. For neurosyphilis also, this is and prognosis scale. Both are good for prognosis, but mainly for neurosyphilis, VDR only. Okay, that's it. Now here, this is the tertiary syphilis. You're seeing what gumma here. So this is a tertiary. This is a tertiary syphilis. Tertiary syphilis, you're seeing what gumma. You're seeing the gummas here. Okay, gumma is seen. Apart from that, of course, heart will be affected. Your tabes dorsalis, etc. Tabes dorsalis, aortic analysis. This will talk later. Okay, right. Now this one is next is your congenital. Next is your congenital syphilis. In congenital syphilis, yes, you see snuffles. The picture can come like this, or this is the Hutchinson tooth, incisors, no, incisor, Hutchinson's tooth, and here saddle nose. Okay, and then this is a saber tibia, saber chin, or we call saber tibia. Saber tibia, take a blade, broken. So these all are characteristic features of congenital syphilis. That's it. This is all you want to say. Okay, that's it. Yeah. Now look at this picture. This picture, if they give you, you see this is a bubo. You see this is a bubo, and this is a groove sign. Between two bubo, that's a groove sign. Bubo, groove sign, and you see a lot of stitches are happening. That stitches are called etiomine. This picture comes. Your answer is, you already know what is it? LGV, lymphogranuloma venereum. That is caused by chlamydias L1, L2, and L3. I always told you how to remember this. This girl Eti, she loves LG product. LG product ka what? LG punch. From LG she makes LG stove. In LG stove she makes bun, bubo. Then she makes gravy, groove sign. And then she also makes fry. Which fry? Fry's test. Freeze test, type 4 hypersensitivity reaction, if you remember. So these all are characteristic for your lymphogranuloma venereum. How easy and how beauty. So you never make a mistake. And here only lymph node will, because it's lymphogranuloma, only lymph node is painful, but the ulcer is not painful. Remember that only lymph node is painful, ulcer is not painful. That is another trick to remember. Okay, right. Now what is this next STD? So because we're in STD, we talk about other disease also now. So syphilis over. This is second one, your lymphogranuloma. Third one, look at this one. Here it was ulcer, but it was painful. Painful, soft ulcer. Painful, soft ulcer. So that is called painful, soft ulcer. Otherwise called what? It is called chancroid. Chancroid. D. So when this D is there, then what I'm going to say? I'm going to say Haemophilus ducrei. Do you see? REYI, ducrei, ducrei. Okay, cry, duck, ducrei. So everything is there. First of all, this is painful, soft ulcer. Soft but very painful. This one. Okay, first question they can ask you. Second one, ducks. Look at the ducks. Ducks, how they go? All the soft duck, the soft ducks. The duck is soft. It is crying. It is crying. That's what it's painful. Duckery. And what it is walking on the rail track or road track appearance. If you see here, this picture, this is the rail track or road track. Rail track appearance or road track appearance and Ramstein scene. Which one? Your Haemophilus ducrei. Okay, Haemophilus ducrei. This you have to remember. Okay, and of course, safety pin appearance also. That picture is not here, but usually safety pin appearance also comes here. Okay, so this one. This is the ducrei. That's one thing. Okay, right. Now, what is the fourth one? What is this cells? This cells. What is this cell? This one, you know already. This cell should be, this is the clue is bacterial vaginosis. So that is clue cells. Clue cells is basically epithelial vaginal epithelial cell, which is distorted by lot of this basically lot of your mobiluncus Gardnerella vaginalis. Okay, so that is basically you see in bacterial vaginosis. Clue cells in bacterial vaginosis. And I'm not going to talk about the Amsel's criteria and Nigel's criteria. Amsel's criteria is basically clinical and Nugent's criteria is a Gramstein criteria. It's caused by Gardnerella vaginalis. And you know this other test also you do whiff test, whiff test you do, and then you whiff test basic KOH 10% KOH, and you get a smell. And here it is grayish discharge, you see. pH is more than 4.5, you see. And then you do Klussel. So these are the characteristic fever for bacterial vaginosis. Bacterial vaginosis. Okay. You remember. And then next, whiff test or this thing. Okay, done. This is done. Next, look at this medias. Beautiful medias. So here we talk about this beautiful medias. What I'm going to check here is yes. So in this medias, you see here. Oh yeah. Oh yeah. Oh, yeah. Yes. Look at this. This green color media, what do you this typical green color agar you see yellow color, this is basically TCBS media. TCBS is thiosulfate citrate, this bile salt agar. This is bile salt agar. Bile salt agar. This is thiosulfate, TC thiosulfate. Bile salt agar. This is bile salt agar, black color colony. And this is string test. String test basically, you put a bile solution and you try to lift up. If it's lifting, these are the characteristics of which bacteria? Vibrio cholera. Vibrio cholera. CHO. I already told about Viva, darling motility, and then Viva, she's working in a TCS company. She carries a carry bag and alkaline peptide water enrichment and transport. She takes a autoclave salt water. Venkatraman Ramakrishnan media. Carry Blair, we have talked enough of that. But if the picture comes like this yellow color would be thiosulfate, bile salt, it will be black color, and then this is a string test you do. That's it. Okay. This one is MYCOLOGY, agar you know, MYCOLOGY. Multimedia. Lactose fermenters always will be pink in color and non-lactose will be yellow in color. I'm not going to talk much. Clad again, the lactose fermenters will be yellow color. Here opposite, the lactose fermenter is yellow. A non-lactose fermenters will be pale color only. Okay. Now this black, this is important. This black color colony, when you give this is called Wilson Blair. Wilson Blair media. Wilson Blair, if you see black color Wilson Blair, this is only for Salmonella. Salmonella. Okay. Because you know that DCA, XLD, the double S agar is for both Salmon Shigella. But only person, bodyguard of Salmon con is Wilson. So Wilson Blair, this. Okay, that's it. That's what I want to stress. Nothing else. Okay. Next. This picture, I am again going super fast revision here. So this is LSS media, low plus serum slope. And this is your potassium KTBA. But that is potassium tellurite agar. Potassium tellurite or tellurite agar. Okay. I always say tell the interns not to loaf around because this is low plus. In which disease you shouldn't loaf around? This is serum based low plus serum slope, potassium tellurite agar. This is usually the fast. So it is fast result. You get the result within 8 hours. But this potassium tellurite is long. It is a selective media, but it takes 48 hours for the growth. Long time. And this potassium media. And then what is this one? Pseudomembrane. Now you will tell me everything. Which disease is this? Pseudomembrane that is causing the bleeding. Pseudomembrane is which causes the bleed. Here you see bull neck appearance. So this is, okay, these are the clinical features. And then here what you see? You see Chinese letter. What is this disease? Chinese letter or cuneiform with metachromatic granules, which is otherwise called Babes Ernest granule, Ernest granule, metaphosphate. So many names are there. Volutin granules. And this is the Albert stain. And this is cuneiform. See, same. It's in a gram stain like this. And electrical precipitation method also. We do antitoxin. So this all goes to which one? Your Corynebacterium diphtheria. You know this one. I don't even have to tell. You guys are already thorough with this. Corynebacterium diphtheria. Corynebacterium diphtheria. For diphtheria, these things comes. Okay. So don't forget. Okay. Easy. LSS potassium tellurite. Now, this one. This is very important. If you get like this, pink color beaded appearance, this is basically what? This is a Mycobacterium tuberculosis. We are talking. So this is acid fast stain, AFB. This is acid fast bacilli we call. So you have used 25% H2SO4 and you have stained it. So you got this picture. So all this beaded, pink color beaded bacilli, beaded is a word you should come. Irregularly stained beaded appearance, that is TB. And this media, this is a Lowenstein-Jensen's media. LJ media, egg containing media, usually is blue color. LSS, low plus is in the diphtheria. Here you see primary TB. Primary TB is always in your lower lobe. It's in the lower lobes, upper region. Lower lobe, upper region. Lower lobe. Okay. But your secondary TB is usually in the secondary TB usually is in the here. It's the apical region. Upper lobes, apical region. Upper lobe, apical region. Lot of air is there, it reactivation. And even it's everywhere diffuse, that is a miliary TB. Miliary TB. It's common in HIV patient. I'm not going to talk the rest of the test run of a TB. You know that gene expert, line probe, say Bacter alert, automatics. Those things we already discussed in our revision class. Now only for picture we're talking. So I'm just going to rush it. Okay. Yes. And look at this. This is a cold abscess. Collar stud. We call it collar stud or cold abscess TB. Collar stud or cold abscess. Doesn't matter. Anything cold, collar, like this type of word comes, that will be your tuberculosis or the microbial tuberculosis. And this one was recently examined came. You see this nodular sclerotic, fallopian tube, uterus, fibrosis, any fibrosis comes on histosalpingography, that's all or TB only. Histosalpingography, uterus, fallopian tube, etc. comes nodular pattern, like this, nodular constrictor comes, then usually it is TB. So TB, it's very special. Every dramatic things comes in TB only. So this is now we are in looking at this picture, you should say it is a leprosy. Leprosy, it's a mycobacterium leprae. It's caused by mycobacterium leprae. Okay, leprae. So here it is. First one is the TT type. TT is basically the hypopigmented type, hypopigmented rash type. And here it is this is your LL type, means the final leprosy type, the real, you call this leonine phase. So this is LL type, you know that one. Okay, here immunity is low, here immunity is so TT basic. And what is this appearance? Now this is an acid fast stain. Again, acid fast stain they did, but here how much percentage? We used only 5% H2SO4. If you remember leprosy, 5% H2SO4 only we are using. Okay. So lepra, because the word lepra, L5, LEP or lepra usual word, so 5, I remember like that. Okay. So look at these appearances. So these appearances which we see here, you call, so cigar bundle appearance. Another one is also called globi. So you remember the leprosy patients, what they do when they are having leprosy, they throw out of the village. So they depend on cigar and the gobi to live in the forest. Okay, remember like that. And in forest, what they find, the only place where you can catch is 9-banded armadillo. 9-banded armadillo can come as a picture. Armadillo, you can go if you want to culture, use normal culture, it will not grow, or food pad of mice. Footpad of mice. So these are the two things they will be eating in the forest, leprosy, armadillo and mice. Don't believe that. Okay. No other place to survive. Now here, this is, these are we're talking about now Clostridium. Clostridium, when you're talking about the Clostridium, spores are important. Spores mean the most common is the subterminal spore that most common is subterminal. And spores can be central. If it's the pores is central, that is the pores is central, then that is bifermentis. We call this Clostridium bifermentis, and then terminal. If it is terminal, you have two that we already discussed. One is your Clostridium tetani, other one is your Clostridium tertium. Tetani will be drumstick appearance. Tetani is drumstick, whereas your tertium is tennis racket. Racket. R for or racket, racket comes. Okay. Now these are the phases. This is that I'm not going to discuss this. Pictures we already discussed. Trismos, Rhizus sardonicus, opistitonos position, okay, I make few spelling mistakes, don't care, okay. Trismos, Rhizus sardonicus, devil's face, look, all this with green spastic face, all this spastic paralysis, these type of things comes. So that is which one, which Clostridium? That is basically the disease is basically your tetanic. So they are Clostridium tetani. The drumstick appearance, tetani, tet for drumstick, tetani appearance. Okay, so that's for Clostridium tetani because of what? Spastic paralysis. This is a flaccid. The next picture, Nietzsche, it's a flaccid. This down one, this is flaccid paralysis. So whenever you have a baby have flaccid paralysis, that's called floppy baby. You hold the baby, it just goes floppy, FF, flaccid. So that is your Clostridium botulinum. This picture comes, you will say Clostridium botulinum, Clostridium botulinum. And this media you're seeing is a Robertson cooked meat media. Robertson cooked meat media. Robertson cooked meat. So Robertson cooked meat media is again for anaerobic, any anaerobic. So you can, this picture comes here, but it's for meat media, for Clostridium. Okay, now next, anaerobic. This one is, see, Mr. Perfect. Why I bring Mr. Perfect Nagarjun here? First of all, he is Nagarjun. We call Nagarjun, let's say. He always has a target. He has a very good target. You see, he has lot of cars. He has lot of cars. Okay, target, he has a car. So, okay, why, what happened? Because a lot of car, he makes accidents. So, why is this one? Naga is Mr. Perfect. He's Mr. Perfect. You know, that's what I put the name. That's what the organism name is, Clostridium perfringens. Okay, Clostridium perfringens or Mr. Perfect. This is Mr. Perfect. So perfringens or Clostridium welchi. All are, both are right. Okay, both are right. Now here what happens is that in close perfringens, first of all, the disease which you're seeing here is called gas gangrene. Gas gangrene. You know what is this? The crepitus. Painful plus crepitus is the word they'll give you and give this picture on pressing this crepitus, and it's very painful and foul discharge with history of injury. So what happened? Our Naga, he has injury in the while shooting the movie, he had an injury. Okay. Yes. So now next one, gangrene. Now look at this. This is on the gram stain. You see this boxcar appearance. This question was repeatedly asked. Boxcar appearance plus he has a club. So the spores are club-shaped spore, club-shaped spores. Okay. One club is epidermophyton. Epi has a club. Another one is our Mr. Perfect Nagarjuna is also having a club. Okay, club-shaped spores. So boxcar club-shaped spores means it's this one. Crepitus gather disease. This is called Nageless. Why I said Naga? Because of Nageless reaction. Nageless reaction. This is a Nageless. You just basically egg yolk agar and you see opalescence. If you strike, it will get opalescence. That's a Nageless reaction. Opalescence on the egg yolk agar. This is a target, and I told C has always a target. So this is a target. There, double zone target hemolysis. Target hemolysis, or like this, double zone of hemolysis. You can say target or double zone. This is a camp, but reverse camp. Normal camp is given by a streptococcus group B, that is agalactiae. Here reverse camp is done by he's little bit, our Nagas little bit crazy, so he goes reverse camp. Reverse camp basically, instead of what you do is that instead of staph aureus, you're going to streaking you are going to streak this one only. You're going to streak the Clostridium perfringens. That's it. Same thing, nothing different, just the staph is replaced by the Clostridium perfringens. That's it. Okay, this much only you're doing. So reverse camp. Okay, so remember, target, reverse camp, boxcar, club, Nagler. This all goes to Mr. Perfect Naga. Okay, who has a lot of car with him. Now comes our Andrea. So when come Andrea and our Maddie, so this is Bacillus. You all know from my shortcut, Bacillus anthrax. Bacillus anthracis. Okay, anthracis or anthrax. So this is a girl. This is a girl, Andrea, because anthrax, Andrea goes very well. So lot of things. See, she has a bamboo stick. She has an inverted fir tree. She has a inverted my picture. Sorry for my picture. She has an inverted fir tree. She has a medusa head. Okay, we are going one by one now. I'm just coming there now. Okay, so let's start. First of all, she has a bamboo stick. Remember, Andrea has a bamboo stick. Car is with the Nagarjun, Mr. Perfect. Here, bamboo stick appearance on gram stain is our Andrea anthrax. And then you see she loves pearls. She loves a lot of pearls. Okay, we can put a pearl. So, a string of pearl appearance in the penicillin agar, string of pearl appearance. Okay, this question can come. This one, look at this outside colline in agar plate. You see medusa head. Look at her hair. It's like a medusa only, like a snakes around her hair. So, medusa head colline, medusa. Frosted glass or medusa head, you can say, frosted head, or both are right. Even you can say frosted head. Her head is like frosted only, frosted head or medusa head. And then this is the inverted fir tree. Inverted fir tree. And then this, I would say Maddie. Maddie is why I say brought Maddie here, because it's a reaction called McFadden. McFadden's reaction is only for anthrax, because anthrax, here capsule here is polypeptide, only amino acid. Okay, rest all are polysaccharide, other bacteria. This is only when it is poly. So McFadden reaction is positive for that. This Maddie is a cool guy. So Ascoli thermoprecipitation. Ascoli cool thermoprecipitation reaction is also for West anthraxes. This is a malignant pustule. Malignant pustule also. Poor Andrea also got malignant pustule. That's what she's not acting in the movie. They say, Saka malignant pustule. Remember like that. Okay, that's it. Now look at this picture, this beautiful picture. You should know this one. You see, this the primary sticking is staph aureus and surrounding there's a colony like this. So it looks like a satellitism. Satellitism. So satellitism, and also look at this picture. This is a thumbprint epiglottitis. Acute epiglottitis infection, acute epiglottitis infection. So this one, thumbprint, that is called thumbprint appearance. One more thumbprint will come in your board retinal. Don't forget that is in the gram stain. Here is a thumbprint appearance. So these two comes. Your organism is very easy. You know what is the organism name? You know very well already. It is your H influenza, Haemophilus influenza. The Phil has a satellite. I remember like that. Okay. And thumbprint, he always wins the game. The Michael Phillip who wins the game. So he is a rises thumb up. Okay. Look at this one, this beautiful colony here. This is a fried egg colony. Fried egg colony. So I told you who is that lady who likes our Diana. Diana, because it's a Dines method. You do Dines method. So mycoplasma. Mycoplasma. Okay. Remember, one more Friday calling comes is a mala. Mala says for her we spoke. Not only spaghetti kikti, she likes that also. Mala says here furfur. But only thing is in Malaysia we have to add olive oil. We have to add olive oil for the colony to make the fried egg colony. Here, the fried egg colony directly comes in mycoplasma. Dines method. Okay, cat everything. Okay, this is what is this agar again. I'm just randomly. This is for antibiotic susceptibility testing. Antibiotic susceptibility. Antibiotic susceptibility testing, antibiotic susceptibility testing. So which is the agar medium using? You're using the Muller-Hinton agar, Muller-Hinton agar to check that Muller-Hinton agar. So what you do here in Muller-Hinton agar, what you do is this, in this agar, you put the discs. These are the discs you put, and then you have to measure this distance. You have to measure the distance. That is called zone of inhibition. Zone of inhibition. So the wider the zone, it is susceptible. That means the drug is sensitive. Okay, if it is not, see here, there is no sensitivity only, so it's a resistant. So if there's a good space, is that is sensitive, it is sensitive. But if there's no space, these are all resistant. You have a particular value to compare with you say that it is working or not. Okay, that's a Muller-Hinton for antibiotic susceptibility testing. Muller for checking the medicines. M for medicine. Okay. This picture, long life. I don't have to say. I say always remember. One is the staff, Malu staff. Staffs like what? Cat. Another one is they're like grapes. The catastic things. The basic thing you should know. So this test is catalase test. You see effervescence here. So this effervescence bubbles you see catalase. Okay, catalase bubbles. If you add hydrogen peroxide, you see bubbles. So here coagulase, you're making coagulum is formed. Okay, coagulase test. So catalase positive means if the test catalase is positive, then you can always say it as a staphylococcus. If catalase positive means it is a staphylococcus. But if it is coagulase positive means it is strictly staphylococcus aureus. Only aureus gives coagulase positive. Okay, confirmatory like that. Now here you see it's a golden pigment. I told you Malayali staffs have a lot of golds in their house because they earn a lot of money from Dubai. And here there's a mannitol salt agar. They are very rich, so they drink only mannitol salt. The special health drink, mannitol health drink, mannitol salt agar. And they are head nurses. So what head colony? This is called pinhead colonies. Pinhead colonies with beta hemolysis. Pinhead. The idea is this is pinhead. Pinhead colonies, big one. Okay, pinpoint, that is for streptococcus. And other one is look at these two. This is a grape-like cluster. I told you that's what they like, grape-like cluster, gram-positive is a grape-like cluster. Grape-like cluster, gram-positive cocci, GPC, gram-positive cocci. Very simple, right? That's it. Now this one, what are the disease caused by streptococcus? Any of this picture comes very simple. This is a carbuncle, furuncle, right? So carbuncle, boil, furuncle, folliculitis, you should look, this is impetigo. This impetigo contagiosa, and this is, this is a scarlet skin syndrome. It's a very good prognosis, also called Ritter's disease. Where Ritter's disease, Nikolsky sign is positive. This derma, you read more about it, but this again, this picture comes. This is also this is a Nikolsky. This is skin is peeling. No, this all are SSS. And What is this one? In pneumonia, Staphylococcus causes lobular pneumonia. In pneumonia, there's this sign called, this is this pneumatocyl. See, pneumatocyl. So these things come. So your disease here is usually the Staphylococcus aureus. Your disease is Staphylococcus aureus. Very, very simple. Very, very simple. That's it. Okay. Staphylococcus aureus will come. That's it. Now, next one here. Look at this one. Now, here, excuse. Look at this. This is a blood agar. I told already when it comes to Streptococcus, we are going to go into beta hemolysis. Beta hemolysis, because complete hemolysis, alpha hemolysis, में partial hemolysis, and this is beta, alpha, and gamma hemolysis. So beta is always complete. We always say that beta means it is always complete. Beta or beta, it's a complete hemolysis. You see wide zone, complete hemolysis. So alpha means are always partial, and gamma no hemolysis at all. So here the organs of group A and group B. Group A and group B are complete. Group A units is Streptococcus pyogenes, and then group B is Streptococcus agalactiae. This is not I'm going to say partial units is Streptococcus pneumonia. Other one is Streptococcus virulence, virulence. They all are this only. And this is Enterococcus. Gamma means Enterococcus. All the Streptococcus. The we are doing Streptococcus means Streptococcus. Streptococcus means strippers. Look at the stripper. The Streptococcus having long chain. So any chain-like appearance. All the Streptococcus has chain-like appearance. Staphs have grapes. They like grapes. Grape-like cluster. Streptococcus strictus, they like to put a chain. So it is a chain-like appearance. Okay, that's it. Now, look at this here. So here if you see, pinpoint appearance. This is a pinpoint colonies. Pinpoint colonies because strippers they dance on the point, peak point like that. Okay. And then what is with this camp test? This is now it's a camp test. When you talk about a camp, which is the gives positive classic, this one you have to know. Camp positive will be only one bacterial streptococcus, that is your Streptococcus agalactiae. Agalactiae. That is group B. Remember, don't confuse, they are same. Group B streptococci or agalactiae. That is the positive one. Camp. Okay, I told you. Agartala boy, Islam, what he does camping. He does camping with the hippocampus, hippolyte hydrolysis. Now the streptococcus ka first one, if they give this is a pharyngitis, acute. This is acute pharyngitis. No, this is acute pharyngitis. So this is caused by which one? Your Streptococcus pyogenes. This is your cellulitis. And this is your cellulitis, usually common in diabetic mellitus patient. This is your necrotizing fasciitis. Necrotizing fasciitis. So this is all the causative agent is Streptococcus pyogenes. Streptococcus pyogenes is the culprit. Okay, necrotizing fasciitis, erysipelas, scarlet fever, everything it will be this only. Now this picture if you see, this is again interesting. This I told already lanceolate. Lanceolate like this, no, leaf like lanceolate. Okay, and this is a carom coin or Droughtman's colony or Droughtman. This is architecture, no, Droughtman colony, and this is a this is bile solubility. No, this is bile esculate. I'm sorry, I'm going to put it here now. This is different ones. Okay. Now, what is this one? If these two tests, this picture comes, lanceolate diplococci, and then a carom coin Droughtman, these all will go to your, and of course, you have to include, I told bio, remember bio, bile solubility, inulin fermentation, optochin. That is your Streptococcus pneumoniae. Streptococcus pneumoniae. This bile esculin E for Enterococcus. So Enterococcus black color comes, the devil, evil, black color. So this one, okay, gamma hemolysis it gives. Now look at this lesion. This is very beautiful lesion. This is your, what is this called? Erythema migrans. They will give you a clue, don't worry. It's a case history that when it comes. If it comes, you know what will migrate? Lyme's disease. In Lyme's disease, Borrelia burgdorferi, Lyme's disease, Borrelia burgdorferi, you, whenever it's boring, you're eating a burger and you're putting a lemon on it. Lemon, if you put a drop, it is migrate in lesions, dominant migrate. Lyme's disease. Okay, that's it. Now this one, this is a way, this is one thing. This is the most important. This is stalactite growth. Stalactite growth It is like on the winters, no, that snow will from the roof, it just hangs down, and that is a stalactite growth. And here you see this is a Vasen stain. You see safety pin appearance. So, and then here is a black death, that is sepsis, black, this necrosis of finger, this because of the sepsis. So this type of things come. So what is the disease you're going to think? You are, of course, automatically you're going to think what Yersinia pestis. Plague, Yersinia pestis, which causes the plague. Yeah, black death, you call it as a black death. Stalactite growth would be a question. They can ask the growth like this. Inverted fig tree, you see who is holding Andrea anthrax. But stalactite growth is reverse, it's hanging like this. That is your Yersinia pestis. Okay, right. Now this will they will give you this a gastric aspirate was endoscopy was taken, it was stained. So this is basically your H. pylori. H. pylori, they say gastric and H. pylori because they have done a Vartin stari silver center. Vartin stari. Black color means it's silver stain. So they saw this appearance. This also looks like sort of seagull, but ideally this is the seagull. You see, it's like this. And gram stain seagull appearance means gram stain seagull shape appearance means that is your which one your Campylobacter jejuni, the one which is causing the Guillain-Barré syndrome, and then you know that is Gram positive, dark motility. There's a Campylobacter jejuni. Okay, seagull also. I told that the gully boy, Guillain-Barré, when they go to camping, they do poultry country, they will do a lot of seagulls were around that picture which I showed there. Okay, seagull appearance, then it is Campylobacter jejuni, right? Okay, look at this picture. Another beautiful picture. Expected question. So this is also inside macrophage, but you see it is a lens shaped, diplococcus, but lens shaped. Here it is gonococcus. No, it's like a kidney shaped, kidney shaped. Here this lesion is very severe sepsis. Okay, sepsis, so it's a purpura fulminans. First it was meningitis, then become fulminans. Okay, here you see what? Here you see the so-called as seed, so flow of seed or grain, they call flow of seed or grain urethritis due to urethritis. So you already guessed what is the bacteria name now. So the first one is basically meningococcus or Neisseria meningitidis. This one is basically flow of seed. This will be your Neisseria gonorrhoeae. Urethritis, because it causes urethritis, very painful urethritis with discharge flow of seed grain. That is what Neisseria gonorrhoeae. Okay, and complication, you know what was Fredrickson syndrome there? Here it is Waterkand perineum. You know that one. I'm not going to talk that again here. Yes. Now look at this lesion. So you have a necrotizing pneumonia, Fisher sign. Alcoholic necrotizing pneumonia, Fisher sign, and this is a rusty, or you call it as the raspberry sputum. So when you have this picture, what is the disease you're going to think here? It is your Klebsiella pneumoniae. Alcoholic patient. Red currant jelly. This is also called red raspberry or red currant jelly. Red currant jelly sputum. Klebsiella pneumoniae. That is first one. Next question you see. This is woody nose. Woody nose means it is Klebsiella rhinoscleromatis. You know, characteristic here is Mikulicz and Russell cells. They are very characteristic here. Okay, scleroma. Okay, that's for later. We can discuss. For now, at least you should know this that pathology it will come. Rhinoscleroma, woody nose. Here it is called rheumy nose. This question was asked in previous FMG also, if you guys remember. It is caused by Klebsiella oziani. Okay, so woody would be scleroma. Woody means it's like a scleroma, no? So here oziani is the crust of very foul smelling crust you get. Okay, foul smelling crust. This is a next one. This is a different STD causing Klebsiella. You might be guessing all right also. So this is a beefy ulcer. Painless. Beefy ulcer, no pain. That is Klebsiella granuloma. Klebsiella granulomatis. Granulomatis. I mean safety pin. This is causing what? Donovanosis. Donovanosis. BB ulcer, safety pin appearance, donovanosis. That's it. Klebsiella granulomatosis. That's it. Seeing the picture, you can tell immediately. Look at this picture. Now here, you will already say me very clearly. This is Prochita, Sara, and Paru. But Vibrio Paru, not our virus Paru. Okay. So this what motility? Swarming. This is the, you know, that staghorn stone, or phosphatase stone. Urease positive, phosphate stone. What is this? When you have swarming motility, urease, gyrase, all these things comes. The thing which is coming to your mind is Proteus. Proteus. Okay. So this is all right. So even Sara, why? Because Serratia also gives swarming motility. And Vibrio parahemolyticus also, and even Clostridium tetani also. They all give a swarming motility. But ideally, Proteus is the question you will be expecting. Okay. And there's a Dines phenomena. If this swarming is fuses, then it's same. If they don't fuse, then it's different species. Okay. Yeah. Now, Ekta Kapoor has come because the rash which you're seeing here is ecthyma gangrenos. So, ecthyma, Ekta Kapoor, ecthyma gangrenos. Everything is colorful here. Everything, that's what you see, the pigmented, you green color pigment. On culture media, you get a green pigment, green, blue, etc. because they have bilirubin. Ekta Kapoor is colorful. Blue pus, green pus, so many, all these type of things are coming. So, the green pigment, this is the organism is before going, the organism is okay. Pseudomonas. Pseudomonas means it's a Ectococcus should come automatically. Pseudomonas aeruginosa. Okay. So this is this condition though repeated as many times. I don't even have to explain. You already know. This is malignant otitis externa. Malignant otitis externa. Diabetic patient with malignant externa. The real example is Pseudomonas. That is enough. So if they give this plate, or they give oxidase positive, all this type of things and all comes, you mark as Pseudomonas aeruginosa. Now comes almost to the end. This is a Weissenstein, I told, stalactite growth, Yersinia pestis. Yersinia pestis, stalactite growth, and then Weissenstein. Look at this. These babies are so beautiful. Here, this is what is this colony called? Mercury. You can say it is a mercury drop, right? Mercury drop, or aluminium paint appearance, or bisected pearl. Bisected, so all are right. Bisected pearl. These are the different names given to this colony. And here you see gram stain, you're getting thumbprint. Thumbprint, okay. Mercury drop, aluminium paint, bisected pearl, and thumbprint. Now, look at this beautiful child. What she's doing, she's just showing a finger and all. So it means this is what? Boarding school. In boarding school, babies, when they have whooping cough, they do. That means it is Bordetella pertussis. Bordetella pertussis. That means I told you, remember, in boarding school, bache ko, they give mercury, aluminum, and bisected pearls when they got whooping cough. That's it. Okay. And thumbprint appearance, one thumbprint appearance, epiglottis in H. influenza, and here thumbprint on gram stain is Bordetella pertussis. That's it. Okay. Now look at this one. This one here is a biphasic. Biphasic medium is your liquid and salt. Both are there. So this is usually also called as Castaneda media. This is usually for blood culture. Any blood culture for your brucella, anything, whatever, salmonella, whatever you want to grow in the blood. If you're suspecting sepsis, you use this blood culture. Okay, that's this double culture media. Bacterial growth curve, I've not talked too much. You know that lag phase, exponential, stationary death. Lag phase, it's a sleeping phase. It's a vacation time. So just the size will increase. The cell size increased. Then lag phase. Then here comes the exponential or log phase. In log phase, what happened? You become active. You go to college, you become active, so your size, you become fit. So size decreases. Because you're active, what you do? You do biochemicals. You do all the biochemical tests in the hospital. You do the AST testing, everything. So the best phase for log phase, biochemical is log phase. Stationary phase, you have a shortcut. This is STAT. stationary. So T, you make it as B. That means, excuse me, here what happens is that you have a spore forming, toxin production, antibiotic, also bacteriocin. These things are happening in the stationary phase. You can have a question from here. Okay. Active phase is college cell. Death phase is nothing. Everything dies. Everything, the cells will die. So it's tab, of course, number of living cell will be equal to number of dead cell. So these things are happening. That's it. Yeah. Rest all, see, these are all, I think most of the pages we covered. See, these are not, see, this is whenever you see a condenser, dark condenser, this is a dark field microscope. Dark condenser, if you see, then that is your dark field microscopy. Dark field microscopy. Okay. When you see a vacuum like this, if you see a vacuum type, that is electron microscopy. So electron microscopy, I don't know the details, we already discussed a lot. Electron is the source and electromagnetic lens are used here, and the slides are made with metallic slide, and then the fixative you use 2.5%, so 2 or 2.5%, glutaraldehyde, SEDEX only, glutaraldehyde, all these things we studied enough. So when you see like this, a dichromic, you see a dichromic mirror, UV light. This is basically a fluorescent microscopy. Fluorescent microscopy. That's it. Okay, that's it. And we are going a rapid revision. So I just want to briefly give, when you see dichromic UV light, it's a fluorescent stain, acrylic orange or chalcofluor, which has been studied. We used to make that the fluorescent stain smear, then we check through the UV light. That's it. Autoclave, I'm not going to talk. This and all you already discussed a lot. Autoclave for all the culture media, the best is autoclave. Culture media, you do autoclave for all the culture media. Autoclave for the culture medias you use, that 121 degrees Celsius, 15 minutes, and 15 pressure, PSC, Pascal pressure. Okay, this is a common one for basically for all the culture media, and anything that is plastic, for all the plastics, gloves, plastic, gloves, rubber, these things will go in your autoclave. That's it. This you have to remember. Next, when you talk about a hot air oven, this is a direct heat. No, so in direct heat, anything glassy, anything powdery, that means anything glassy means all the glasswares you can sterilize. Anything oily means anything powdery, paraffin oil, as we say, anything oily, paraffin oil. Okay, paraffin oil, liquid paraffin. Basically, I want to say liquid paraffin, it's not oil, liquid paraffin. Okay, anything liquidy, anything glassy, anything powdery. That means this gloves powder, no, the gloves dusting powder, no, gloves powder. These things, okay, anything glassy, anything liquidy, anything paraffiny, anything powdery. These things will go in a hot air oven because you can't put the plastics. What if it will burn? So you can't do. And of course, all the surgical instruments, sharp instruments, everything you can put surgical instruments here. So you can put in the hot air oven. That's it. Okay. This question can be asked. Inspiration, tinderlization, if you see, inspiration, it is just 85 to 88 degrees Celsius for 30 minutes. 3 consecutive days, 3 days, 3 consecutive days. But for tinderlization, how to remember? 10, you remember 10, 10, 10, 10, 10. So that becomes equal to 100, no? So here, what you have to do is that 100 degrees Celsius, 20 minutes for 3 days. This is also 3 days only. But what I think you study, inspiration, you usually do what? Serum medias. Serum containing serum or egg containing, that is LJ media, LSS media, you do inspiration. Tinderlization, tin of sugar. Sugar containing media, you do tinderlization, sugar medias. Any media which is containing sugar, you do tinderlization. That's it. That's much only. Okay, not much. Now, some of the few points, basic point they can ask you. See, disposable catgut sutures, gloves, swab, which radiation you use? We have X-ray, gamma. No? So this is gamma. Gamma is a highly penetrating. So gamma rays is best for catgut sutures. This question can be asked. Gamma, especially for catgut sutures, they can ask gamma. Formaldehyde is used for for fumigation. 40%. Fumigation. Glutaraldehyde is a 2% SEDEX. That is for any endoscopes. except arthroscope, except arthroscopes for any ortho joint related arthroscope. So for that, which is the best? Arthroscope. Plasma sterilization. For except for arthroscope, the best is plasma arthrosterilization. Orthophthalmology is better than, it's better than glutathione because no need because no need activation, no need it's already active, you no need to activate it. Okay, that's it. Heart lung machine, respirator and all, which is the best one? Ethylene oxide. I already told Ethi, she works in the ICU. Ethylene oxide. That's it. Okay. Plasma red, sterrad plasma, they are same. That is usually best for arthroscope. That is one question they can ask you. Okay. Heart lung machine respirator, ethylene oxide. This is all we already discussed now. Now, biological indicators may be an important question, very easy. Autoclave and plasma sterilization, same. Which one? Because it's a steam, both this is steam, and here also sort of plasma steam. So, their organism bacillus Sterothermophilus. Hot air oven, you have to remember hot, what you say, what is hot? Hot tea, hot sabji, hot atta roti. Means T for Clostridium tetani. Sabji, it is Bacillus subtilis. That's it. This atrophy is not that much used. Okay, they might not ask you so much. Don't worry. So subtilis will be frequently asked. Clostridium tetani, subtilis can be asked. Okay. So Bacillus stereothermophilus definitely they'll ask here also. Filtration. Filtration. Which is the best filter coffee? Brew. Brew is the best filter coffee. Right? Brew coffee is the best filter. Brew filter coffee is my favorite filter coffee. So what is the organism of filtration? Brevendimonas. Bruvendimonas for filtration के लिए best indicator, you should know. And what about radiation? Radiation, you know that, right? Which is best now? It's a Fumilis. Fumilis nowadays, Puma shoes. Fumilis. P-U-M-I-L-L-U-S. Fumilis. Okay. Fumilis. So nowadays, Puma shoe radiates. That's it. Okay. Gas ka Eti. I told you Eti, she's working in ICU, but still she manages to cook what she manages to make. She manages to make sabji and also roti. Okay, she can cook these things. And gobi, she makes hot gobi sabji. Okay, G. So Bacillus globigi. This is the G for gas sterilization. That's what she got gas. That's what Eti got gas. We forgot also which is a gas. Eti got a gas because she was eating gobi. Also, you can what Bacillus subtilis is fine. Bacillus subtilis and Bacillus atrophius also. Atta roti atrophius. But the best one would be a globigi. That's it. These are the markers. Few markers that you shouldn't forget. And then here now, I'm going to cook one. So remember all infected animal waste. See, this is a placenta, disinfected. Sorry, this is a surgical tissue, red blood bag. Blood bag is very important because it's a plastic bag. It looks plastic, but it is not plastic. Okay, it's specially made to put it in the thing. Animal, all your gloves, masks, everything goes in which bag? It will goes in the yellow bag. Okay, that is one question. This question they can be asked. Cytotoxic drugs also. All yellow bag. Okay, this you know very well. All infected items. Okay, animal, human, microbiological, all the gauze swabs, masks, everything will go there except this gloves will not go there. Okay, remember now we are going the yellow bag. Now next one is Sean. Look at this. Euro bag. Though it is, see, red bag, Euro bag is yellow, it goes in red color. Blood bag is red, but it goes in yellow bag. That's googly things. Okay. So Euro bag and all the plastic vacuum all the recyclable plastics. You know, plastics means when I'm saying the tubes, IV sets, IV plastic sets, you know, I'm talking tubes, IV sets and all, and the gloves. These all recyclable item, all the recyclable items, plastic, etc. goes for red bag. R for red bag, recyclable items. Okay. Only thing is that remember the blood bag will not go in red. The blood, though it is the blood bag is red, it goes in yellow bag. That's it. Okay, remember that. Now this one. This is a the sharps. I mean, usually I'm thinking needles. Okay, needles, the sharps, these things will go in which one? White. Once again, yeah. So this needles, sharps, they all go into the white. Sorry, I have to change the color. So this will be going in the white panchaproof container, white. Okay, yes. Now the last ones. The last ones, once again, the last ones. Look at this. Anything, anything, like broken glass, body implant, body implants, broken glass, body implants. Implants means I'm talking about cochlear implant, pacemaker, intrauterine device, IUD devices. All these things, they go into which bag? Blue bag. That's what I'm putting blue color, blue bag. Okay. All these things. See, even the ortho plates, ortho plates, the joint for fracture, the plates and all the plates, steel, everything goes into the blue bag. That's it. Okay. This is the one short view. Okay. I'm just going very quickly. And the broken glasses means when you talk broken glass, all the slides and everything goes there only. Okay, fine. Now few things which is already revised. See, most of the only two immunoglobulin A is dimer. It's like this dimer with a J-shaped junction. Yeah, dimer. And what is this one? Pentamer. This is your IgM. M is a milliner, so big, so pentamer. So this is a pentamer. Five things are there. Five. So valency will be 10. So pentamer. Rest all IgG, IgA, and Ig, D, and E. So they all are usually monomers only, nothing special about it. This is a lattice hypothesis. Marax lattice hypothesis. You know this very well. So this one question is always asked repeatedly. There is when antigen antibody reaction, there is something called zone of antibody and zone of antigen excess and equivalence. So when we talk about zone of antibody, the antibody is more, that's a pro zone. If you forgot also remember, your body is like a pro. Keep your body like a bro. Okay, antibody. Pro body. Okay, pro zone means antibody is more. Pro zone. If it is post zone, this one. If it's a post zone, antigen will be more. This is a post zone phenomena. Okay. Equivalence may it's here the antigen is more. Here body more. Equivalence means both are equal. Antigen antibody will be equal. That is the Marak-Lakin hypothesis. Now, few examples of the vaccines have been repeated. Asked live vaccines may the characteristic example BCG vaccine and MMR vaccine you always know, and then polio may oral polio vaccine, that is Sabin, very characteristic. Apart from that, which you have to know is rotavirus, yellow fever, chickenpox. These are also the live vaccines: rota, yellow fever, chickenpox, OPV, or live vaccines. Okay. Now, what about the killed vaccine? Killed vaccine, one shortcut which I like to give you is, you remember, somebody is killed means what you say, RIP always. You say RIP always. R for rabies is always to be killed. And then IPV, injectable polio vaccine, that is your Salk type. Salk is killed, you know that. And P for pertussis is killed, you know that. A for hepatitis A virus. Influenza can be both. Hepatitis usually it is this thing. Okay, this is a RIP always. Toxoid, very simple because it is your DT, TT. These things are toxoids. Okay, toxoids. Okay, subunit vaccine is very important. Frequently, this is called for HPV and HBV for cancer causing vaccines, for cancer preventing vaccines, cancer vaccine you can say, for cancer. So this question can be asked subunit. Nowadays, they are asking this. So self-fraction. Self-fraction means anything with a capsule, protect the capsule. So which are the vaccine that is cellular fraction? That means only capsule. You know that means you should remember the capsular bacteria. The common bacteria here we're talking is your Streptococcus pneumoniae, subcellular fraction pneumonia as a flagella called meningitis, H. influenzae also, which causes the meningitis, and also your Neisseria meningitis. Neisseria may also causing meningitis. So these are the cellular fractions. Recent exam they have come. That's what I've added this. Okay, this is super for revision. So please come with me. I'm going to very fast. Okay, it's for your benefit only. I'm almost we're going to finish now. Autograft means auto vibrator. Auto means owner. He's the auto owner, no auto owner. So auto means own body. No, from the you graft is from the own body. Usually, which graft is skin graft? Skin graft, for all the skin graft, we are using autograft only. From our own body, we're taking skin and putting wherever needed. Okay, so skin graft, it's our own body, right? Now that asked auto. ISO means, ISO means I for ISO or synergetic means identical twins. You're making graft from identical twins. I for I for twins. Okay, identical twins. What about three? Allo. Allo to Allu Arjun. Allu Arjun is the most popular, no? So he's a friend. He's a friend. So that means what you do, you take from the another person. You take from another person. Human. Okay, another human. Another human, you're taking the graft and you're doing. So this is the most common. This is Allu Arjun is the most common popular hero. So it's the most common graft, which is the most common allograft. So from other human, same species. So xeno means you're totally going to another species. It's either you're taking from animal or bird or whatever, another species. You're taking graft from another species. That is xenograft. This only I want you to know. Okay. So they can ask any question easily. You'll have. Isograft is otherwise called syngenic. Also, don't get confused. If you don't have identical, you don't make mistake there. Okay. Right. Now next one. There's a few diseases because we didn't have much time immunology, so I'm just stressing the basic thing. Chronic granulomatous disease, the deficiencies NADPH oxidase deficiency. NADPH oxidase deficiency is the main one. Here, the two tests will chronic granulomatous disease. A lot of infections can happen. Abscess, everything will come, but then the two tests are important. What are they? One is nitro blue tetrazolium test. This becomes negative. Another one is dihydrorhodamine test. This also become negative or less. Okay, that's important in chronic granulomatous disease. In Chidia-Kigai system, there is a defect in the phagolysosome formation. Phagolysosome formation in Chidia-Kigai. That is the main thing you should know. And there will be giant cells. You will see the giant cells will be seen. That's it. Okay, that's just for chronic granulomatous and Chidia-Kigai. You will know that one. Okay, you're right. Next one. Now for the other diseases. Now for the other diseases, what about Bruton's diagram? Bruton's for B. So B means you have B cell defect. In the B cell defect, all the immunoglobulins will go down. All immunoglobulins go. Whenever the B cell immunoglobulin go down, the characteristic infection is Giardia. Giardia infection, if the flu comes Giardia or enteroviruses, if they come, you should think about the Bruton's gamma globulinemia, X-linked or Bruton's gamma globulinemia. B for B cell. Okay, all immunoglobulins go less. That's I'm just going to go detail. So 1, 2, and this is 3. Next is a DiGeorge syndrome. DiGeorge means George likes to catch. What he likes to catch, the shortcut that is just CATCH catch 22. 22 because there's a chromosome 22 is involved. Chromosome 22, especially Q11 deletion happens. Chromosome. Okay. C for cleft palate. Cleft palate will be there. And other one is here, this one, abnormal face, A for abnormal face. The face will be abnormal face. T for, thymus dysplasia. Thymus will go down, not a thyroid, thymus dysplasia. Thymus gland defect will be there. And C for, C for cardiac problem. There will be a lot of cardiac issues. H for hypocalcemia or hypoparathyroidism, not hypothyroidism, hypocalcemia. The idea is in DiGeorge syndrome, thyroid is not affected, but your thymus and your parathyroid gland is affected. No thyroid problem. Remember, DiGeorge, there is no thyroid problem. That is one question I want you to remember. Now, next one is viscot. In viscot, already the shortcut is VAS. You remember water, WEATER. How to remember? Very simple. Viscot already WA. T for thrombocytopenia, and E for erythema, eczema rashes. That's it. Thrombocytopenia and eczema rashes only you have to remember. Here the viscot may IgM goes down, where your IgA goes up, increases. Okay, that's it. This is the only thing you have to know here. Viscot Ulrich. Oh, IgE goes high. Sorry, And ataxia telangiectasia, here what happened, ataxia telangiectasia, both goes down. Sorry, 1 second. Here, see, A and E are there. So here what happened, both your IgA and IgE goes down. Both will go down. Okay. So of course, you have ataxia and telangiectasia will be there. That's it. That is the only thing you have to remember here. That's it. Okay. Now the hypersensitivity. Almost we're coming to the end now. Now you will be very enjoying this topic. You know this one. Hypersensitivity reaction, allergic reaction. Type 1 is any allergic hypersensitivity or atopic, anything allergic hypersensitivity. So allergies may you can say bronchial asthma, allergic rhinitis, then atopic dermatitis, all these things, atopy, dermatitis, anaphylactic reaction, anaphylaxis, all these words, allergies will come here only. Remember that. Okay, one thing. Now, number one. Now, this is number one. Now, yes, now in allergy, any allergy. So, example, let's go to here. Tests may you have lot of tests. Okay, that's what here the infections. Basically, I want to say in which infection Cassoni test is positive in your hydatid cyst. In hydatid cyst infection, you will have what test positive? Cassoni's test. Cassoni's test. Type 1 hypersensitivity reaction. This could be a question they can ask you. Bronchial asthma rhinitis, they can ask you. This can they can ask you. Experiments may you know that the Theobald phenomena, Theobald Smith phenomena, Prusnitz reaction. Another one is Scholz-Dale phenomena. Okay, these are a little bit tricky words. Theobald-Smith, Prusnitz reaction, Scholz-Dale reaction. These are the three experimental reaction. Type 1 hypersensitivity reaction. That's it. Okay. Now type 2. Type 2, very easy. Type 2, my blood group is Rh positive. Very simple. My for myasthenia gravis. Blood transfusion, and other one is one is blood transfusion B, and other one is your Rh incompatibility. Then what is this Rh? This Rh is rheumatic fever. Rheumatic fever is type 2, remember, because type 2 is otherwise called antibody dependent cytotoxicity. Cyto2, remember, like Cyto toxicity, remember, like that. So it is easy, toxicity. What about 3Gs here? Here the 3Gs would be Graves' disease, and then good pasture, and other one is your graft. In graft disease, this one disease, that is your hyperacute graft rejection. Hyperacute graft rejection. That one, hyperacute graft rejection comes here. There's all question. There is nothing can be left. Okay, archability. And IS is basically idiopathic. Once again, idiopathic thrombocytopenic purpura. Idiopathic thrombocytopenic purpura. Okay, idiopathic thrombocytopenic purpura. This is also RHI. And positive P, this is very simple. This is pernicious anemia. Pemphigus vulgaris. That's it. Okay, not much asked. So this is one. We finished with the type 2. Now type 3. Type 3 very 3 means it's everyone knows this Lord Shiva's this trident. Trident is sharp, right? SHARP. S for SLE, serum sickness. Type 3 hypersensitivity. Type 3 hypersensitivity, it is an immune complex. There is an immune complex formed, immune complex hypersensitivity reaction. Very simple. H for hypersensitivity pneumonitis. Hypersensitivity pneumonitis. PNUMONITIS. Pneumonitis. You have to know because these switching questions will come. Serum sickness, A for Arthus phenomena, Arthus reaction or Arthus phenomena. R for here it is rheumatoid arthritis. P for pan. Polyarthritis nodosa. That is also the question they have asked recently. Okay. Polyarthritis nodosa, rheumatoid arthritis, orthosphenomena, hypersensitivity, pneumonitis. Okay. You can have reactive also. You can add reactive arthritis also. Nothing wrong with it. Okay. That's it. This means for type 3. Type 4 is very important. Type 4 would be called delayed hyper. All are immediate. This is only the delayed hypersensitivity or cell mediated delayed or cell-mediated hypersensitivity reaction. Okay, delayed T cell mediated. Usually rest all antibody. This is a T cell mediated hypersensitivity reaction. Contact dermatitis, anything with the contacts, nickel, alloy, any allergic substance, with that, which with the IV poison, anything poison, contact dermatitis. Non-infectious disease, if you say Hashimoto thyroiditis, Hashimoto's thyroiditis, even your diabetes mellitus 1 will come here, Crohn's disease. These things are a classic example for your Crohn's disease, Hashimoto, diabetes, or non-infectious. Infection-related means you can say candidiasis, T cell defect means candidiasis, cryptococcosis, all these things come very, very commonly. Okay, that's one. Histoplasma, everything, histoplasma, etc., etc. Graft versus host reaction, this is graft versus host reaction itself, and also chronic rejections. Chronic rejections will come in type 4 hypersensitivity reaction. Don't forget, very, very important. Also, one more thing you not forget, lepra type 4, lepra type 1 will come here. Lepra type 1 is type 4 hypersensitivity reaction. But your lepra type 2 would be type 3 hypersensitivity reaction. That is beauty. So idea is 1 plus 4 is equal to 1 plus 4 is equal to 5 and 2 plus 3 is equal to 5. That's it. That will remember. Granuloma, any granuloma will be sarcoidosis, TB, all these things. Anything granuloma related, that would also be type 4 hypersensitivity reaction. But the most important thing frequently asked in the exam is your skin test. You know that what are they? They are tuberculin test, lepromin test, tuberculin, lepromin, freeze test, F for free, F for pro, 4, freeze test, one more Montenegro. Where is Montenegro comes? Montenegro. Montenegro test, where colors are. It comes in the colors are test and Montenegro. So these are the tests which is come type 4 hypersensitivity reaction. That's it. It's a revision, nothing else. I don't want to bring yeah. Now this complement pathway also you can expect some question. They can here and there and they can touch you. And it's very simple. Row the basic, you will do it well. Classic pathway is usually activated by which one? It is usually by IgM more than IgG, but IgMG. Alternate pathway A for A, so A for apple, A for IgA. So it's easy. Lecithin pathway is by mannose. Mannose binding protein, lectin pathway. Okay. So first complement here would be here. It is your C1, C2, C4. Okay, not C3. Alternate pathway it is C3. But your lectin pathway it is just C2 and C4 only. Okay, this you have to remember. First one is acquired immunity or adaptive immunity, but alternate and lecithin are innate immunity. Innate. Okay. Innate immunity. These two are innate immunity. That is one. Okay. MAC complex is basically when you talk this membrane attack complex means it's a C5, 6, 7, 8, 9 complex. So whenever there's a MAC deficiency, which is the infection you can expect, which bacterial infection, the repeat last question, Neisseria. We already discussed, but again I'm going to bring it here. Neisseria, especially meningococcus, we're talking infections are common. Hereditary angioedema means you have edema all over the body. That is because of C1 esterase deficiency. C1 esterase deficiency inhibitor. CCN esterase inhibitor deficiency. So because this is not there, all the complement system gets hyperactive. So there will be a lot of swellings and complements more swelling. So C1 esterase deficiency leads to hereditary angioedema. This question was asked recently. So that's what I'm talking about this here. And whenever MHC1, major histocompatibility HLA1, HLA2, HLA1 is always present in nucleated cells. All the nucleated cell, that means it includes APC cells also, antigen-presenting cells also, except two cells. Where it is not present, one is your sperms and other one is the RBCs. Platelets too. Platelets already there is no nucleus, so it's not that platelet. Sperms, RBC, platelet, you don't see MHC1. MHC2 would be definitely seen in antigen presenting cells. Antigen presenting cells means I'm talking about B cells, dendritic cells, macrophages. Okay, B cell, dendritic, and macrophages. B cells, dendritic, macrophages. You're talking. They present the antigen 2. Here, one will present. This will be CD8. 2 will be presenting to CD4 because 1 into 8 is equal to 8. Here, 2 into 4 is also equal to 8. Make sure you get 8. That's it. Okay. Very simple. Don't think too much. It's a very, very simple. See, even if you forget division, Andhra Pradesh recently divided into 2. AP was divided into 2. 1 means we have one cell is equal to 1 nucleus. So all nucleus, one cell is equal to 1 nucleus. So anything 1, all nucleated cells. That's it. Sperm and RBC, there's anyway no nucleus. Platelet also doesn't have. Sperm, for some other reason, they don't have. That's it. That's it. That's it. Okay. Now, no, the last part. We're coming. I'm trying to finish, but it's going on. This is IgG. G for God. Remember G for God. Okay. So that means what? This is a maximum concentration. Maximum concentration in the blood is G, IgG. And you know this causes chronic infections. All the chronic infection, IgG is increased. And G causes all things. God can do opsonization. God can do opsonization. God can do precipitation reaction, God can do antigen agglutination reaction. Every reactions will come in G. And this is the maternal. This is the first, especially G1 is to cross the mother to child. Maternal to child crossing through placenta is IG1. Okay, that's very important. So maximum concentration, maximum serum concentration, maximum half-life also maximum, half-life maximum, serum maximum concentration, or in chronic infection, observation, PPT agglutination, SP. This is common. This one, this is IgG. Look at the most important guy, the Milliners. That's what we call Milliners antibody. Milliners antibodies is IgM. That's what M. Okay, because they are rich. M means itself, you should know that the molecular weight. They are so much money. The molecular weight highest is for M only. And apart from that, if you see everything, complement pathway, everything here, you should know that, excuse me, complement pathway or any reaction, opsonization, precipitation, every reaction is M causes. And another thing is acute infection, cause acute infection. And one more thing is what? It's a pentamer, big one, pentamer. That's what the valency is 10. Valency is equal to 10. Okay. Milliner. That's what milliner, molecular weight, acute infection, complement opsonization. These things are very common for the M. That's it. Okay. This you have to remember. And one more thing in the rheumatoid arthritis, if you remember, it is basically IgM against which one? Against the it is the IgM against the IgG protein. Okay. IgM against the formed against the IgG. That is rheumatoid arthritis. Not to rheumatoid, even cryoglobulinemia also. Cryoglobulinemia also. Okay. IgM formed, IgM is the rheumatoid factor is basically IgM formed against the IgG. So basically it's IgM only. Okay. So that's one thing I want to add here. And then I'm sorry. Yeah. We're almost done. We're almost done here. Then next one is now next. Excuse me. Next. So just a little bit about IgM and we're finishing it. We did a great job. We almost covered everything. IgA means it's for secretion. Any secretion on the serum you can see. So if IgA, basically any secretion, milk secretion, serum, any body secretion, you can see IgA. Okay, what about IgE? IgE is the least, it's the least half-life because it's enemy, so half-life is very less and low concentration blood also. Everything is less. E means bad, evil, so everything is less. And one important thing is that you can see it in any allergy. Any allergy, it is increased. And also in any parasite infection, low-plus pneumonia, any pneumonia, in fact, any parasite infection, you can expect filarial infection, filariasis, low-plus, all this is, and also it's associated, usually it's associated with eosinophilia. Eosinophilia, E for eosinophilia comes together only. Okay. Then D is nothing. D is basically the D is always associated with B cells. That's it. Okay. D always goes with a B. That's it. Immunoglobulin D always goes with a B. That's it. Finished. Okay, that's all. We've done maximum revision. Even I'm so happy that even the immunity part I thought we left, that was we covered now. So nothing is left. No, there is no way that you are, you're going to. I mean, you'll do maximum correct on it. That's what I know. Okay. So once again, all the best. Do well. Waiting for your results. So I pray for you guys. Do well, and you will really shine. Okay. That's all I wanted. Take care. All the best.